right, let's do it. Good morning, Guam, and welcome to the KUAM News takeover of Guam's favorite I-94. Of course, it's containing COVID 621 on a Friday morning, April 17th, as we are more than 1 month into this war against the coronavirus here on our island. And the show, thank you guys for joining us. Good morning on you.
Half a day, everybody.
Thank you to our Facebook Live viewers, of course, on the KUAM News Facebook page. Please watch and share the broadcast. We have a lot of guests lined up this morning, a lot of real information in real time for you guys. And coming up this hour, we're going to be speaking with Father Paul Goffigan. They made some changes due to the COVID-19 crisis with a deal with funerals and just really important stuff that you guys need to know, okay? And just real quick, running through all the ways you can catch the show, of course, right here on the radio. It's Guam's favorite. Great to be back. 93.9 FM. We're streaming live on the KUAM News app and at KUAM.com. There's an audio stream, Docomo Channel 10, and, of course, our KUAM News Facebook page. And then at 8 a.m., we flick the switch and jump onto KUAM TV 11, just part of our effort to bring you this show and this information as many ways that we can. At 6:23, as we always do, we start the show with a deep dive into the day's COVID-19 news. So from the KUAM News team, good morning, Sabrina Salas-Mazzanotti.
Half a day and good morning, everyone. The latest from the Joint Information Center coming down at 9:40 p.m. The Department of Public Health and Social Services tested 11 individuals for COVID-19 yesterday. 0 tested positive through public health. There were no results reported from the Guam Memorial Hospital, which now has testing capabilities. To date, 135 cases have been confirmed through COVID-19, with 5 deaths and 86 recoveries. Recovery meaning a patient is no longer considered infectious. According to CDC research and published guidelines, a patient is classified as recovered after at least 72 hours have passed without fever or additional respiratory issues, and at least 7 days have passed since symptoms first appeared. All 44 remaining cases are in isolation. $11 million worth of checks should be going out today. The governors last week announced that we are advancing $11 million out of the $134.8 million approved by the IRS and federal economic impact payments. DRT is issuing the advance payments to tax filers with adjusted gross incomes of $10,000 or less in tax year 2018. As for the remaining relief checks, because Guam was among the first territories to submit a draft implementation plan, the checks associated with this program may be cut within about a week from now. And that, of course, is based on IRS approval. The local business community will need to keep a close eye on Congress in the coming days. Many Guam small businesses have already received federal stimulus funding to keep them and their employees afloat during the virus crisis. Our Nestor Lecanto asked the governor about this funding as well as her plans for economic recovery.
My question for the governor, and we just got a release from the SBA, and they issued a statement attributed to Treasury Secretary Stephen Mnuchin and small SBA Administrator Carranza. And if you'll indulge me, let me just read 2 sentences here. By law, the SBA will not be able to issue new loan approvals once the programs experience a lapse in appropriations. We urge Congress to appropriate additional funds for the Paycheck Protection Program, a critical and overwhelming bipartisan program, at which point we will once again be able to process loan applications, issue loan numbers, and protect millions more paychecks. As you know, the PPP and the EIDL have been relied on heavily by our local small businesses. I'm wondering if you had a comment on that, if, in fact, the Congress does not appropriate any more money.
Right now, I know that we have, I think, about 53 million already in loans for the PP protection program, and I know that the SBA also has been doing the EIDL loans, and so like I said, right now we have in the coffers 53 million. I don't really know if that's all been distributed, Nestor, but certainly if the funding source is not there, then we can't continue on with the program, and we'll just have to work with Congress to provide more funding availability and funding sources for the program. But We have 53 million already, and I think that equates. I'm trying to find my information on that in terms of how much businesses that is. So let me see. Okay, so we do have 53.6 million for the SBA, the PPP program, and nationwide there's like 247 billion dollars that's already been approved. So for our loans for PPP, we have approved 238 businesses. Um, I think that is a big amount of loans that have been approved. I don't know if that is, I don't know what's pending. I don't know how many, but we certainly will be in the line for those loans to be funded again.
Great. Thank you, Governor. Second question is, I know you probably at this point, based on your previous statements, believe it's a little might be a little too early, but have you at least thought about bringing in some economic advisors and starting to make plans to restore our economy once we do finally emerge from this coronavirus crisis?
Sure. Yes, I have. Actually, our economy cannot be restored, Nestor, unless, of course, we have the health and safety of our community, and so that has always been our focus. But the concern about the health of the economy has always been along with that focus. I am establishing a panel of individuals representative from the government, the private sector, economists, also along with our medical advisors, and that's going to be my recovery panel advisors. And at those meetings, we will be discussing strategies and the methods and how we will move forward with the recovery period. It would heavily involve data. It would heavily involve how our hospital capacity is. It would also look at how good our contact tracing and surveillance will be, and our capacity and expansion of testing. Those are some of the key indicators that I would have to be looking at in order to feel into the recovery phase.
According to the SBA, it has processed more than 14 years worth of loans in less than 14 days. The Chamber of Commerce, in the meantime, is reacting to the SBA, as the Chamber has been informed by the Small Business Administration that the monetary threshold for funding for the PPP, the Paycheck Protection Program, and the EIDL, the Economic Injury Disaster Loan Program, has been met. The SBA will not be able to issue loan approvals once the programs have a lapse in appropriations. The Chamber saying, we sincerely apologize for the postponement of their webinar, as we know that there are many businesses that were looking forward to their virtual event that they were going to be holding about these programs. They hope that Congress will appropriate additional funding to support both these very important programs that are essential for our small businesses. The Office of the Attorney General is following a crime level spectrum when prosecuting offenders during the pandemic, with nonviolent offenders being booked and released and violent offenders booked and confined. Based on this spectrum, earlier this week, the AG's office released two 19-year-old men, BK Petrus and Rafiki Kinam, from jail after being arrested for terrorizing residents at Harmon Breeze Apartments. Adriana Cotero spoke with the governor about this issue during the press conference.
As I'm sure you know, Governor, the Office of the Attorney General has implemented a crime spectrum to follow for prosecution during the pandemic. Assisting non-violent offenders being booked and released, and at the other end, violent offenders being booked and confined. There was a recent incident with two offenders being released and falling in the middle of the spectrum. However, they had made death threats to a family. They were charged with terrorizing and criminal mischief. There was property damage and home invasion.
Right.
Yet they were released, and now victims, they're feeling like they're left in fear and feeling victimized by the criminal justice system.
Yes.
So what are your thoughts on this issue at hand?
My thoughts were this. I was not aware of this until earlier yesterday. So I asked my legal counsel to work with the courts. My the whole focus on this, Ariana, is so that we can also make sure that our DOC population is not increased in any of the exposure possibilities. I am concerned that this two arrestees, it may not be violent, but I was not very happy that they were released. And we are working closely with the courts also to look at what are some of the things that we could put in to again protect the DOC from exposure. And some of that would be one of that I am thinking about is to test these people before they are confined. So, and also to make sure that at the DOC there is a designated building that's solely for possible COVID PUIs and for isolation and quarantine. So we need to institute that. And I totally understand the feelings of our community, of their insecurity, and this crime to me is not a minor crime. To me, I see it as a much more violent crime, and we are working with the courts to have a much better clarity on it.
Statement in response to the governor's statement, quote, "It was admittedly surprising that she was not happy given that our approach was taken in line with the directives of her office and the public health authority. However, now that they are prepared for returning to standard confinement practices and are working with the court to manage the prison, our office will move forward in support of this new direction." Again, that was from Attorney General Levin Camacho. The governor, in the meantime, will not be getting her curfew authority. Senator Amanda Shelton's bill that would have authorized the governor to impose a limited curfew for all was resoundingly rejected by a 12-3 vote. Only Shelton, Speaker Tina Munoz-Barnes, and Vice Speaker Talina Nelson voted in favor of the measure. The governor was seeking to put more teeth into her order for people to stay home, but many in the public balked at the idea, citing an infringement on civil liberties. Senators did pass 6 other bills unanimously. They include expedited procurement of COVID-19 medical supplies, an exemption from the 900 instructional hours requirement for public schools, an exemption for the service learning requirement for graduating seniors, and specifying who gets hazard pay in the COVID-19 pandemic. As of today, 94% of USS Theodore Roosevelt crew members have been tested for COVID-19, with 615 positive and 3,958 negative results. 4,046 sailors have moved ashore. 5 sailors assigned to the crew are in U.S. Naval Hospital Guam being treated for COVID-19 symptoms. One of those sailors is in the ICU for increased observation due to shortness of breath. As reported, 1 sailor passed away earlier this week. Meanwhile, NBC News is reporting that U.S. Secretary of Defense Mark Esper indicated that it's possible Navy Captain Brett Crozier, who was relieved of his command of the Roosevelt after raising concerns about a coronavirus outbreak, could be reinstated. An investigation into the incident was completed last week, and the Navy is now reviewing its findings. Mark Esper stating, quote, "It will come to me at some point as I'm in the chain of command. I can't comment on that further, but I got to keep an open mind with regard to everything." Crozier lost his command on April 2nd after sending a strongly worded letter to Navy leadership detailing his concerns about the spread of the virus on the aircraft carrier. The letter was leaked to the media and generated national headlines. He reportedly contracted COVID and is being quarantined on Guam. In national news, President Trump will hold a video conference call with the nation's governors today to discuss federal guidelines about reopening the country. Natalie Brand has more details from the White House.
There's also death involved in keeping it closed.
President Trump expressed an urgency to reopen the country and says he will announce new guidelines today about how to ease restrictions in some areas.
We think some of the states can actually open up before the deadline of May 1st. And I think that will be a very exciting time indeed. Governors are looking forward. They're chomping at the bit to get going.
The rolling reopening will likely begin with 9 states that have fewer than 1,000 coronavirus cases, provided the governors there agree. but health experts warn it will only work if more testing is in place.
The success or failure of that rolling reentry program, as I call it, would be the capability of being able to test, identify, isolate, get someone who's infected out of circulation.
The president is also talking to lawmakers today as negotiations have stalled over adding money to the Paycheck Protection Program for small businesses. The program, which provides forgivable loans if businesses keep employees on the payroll, is now out of money. Treasury Secretary Steven Mnuchin is negotiating with Democratic leaders for an additional $250 billion.
Telling people to stay home and not giving them the amount of money they need to support their family, buy their groceries, buy their essentials, and pay their rent would be a catastrophic mistake. And forcing everyone on unemployment would also be a bad mistake.
Democratic leaders have called for modifications to the program while also wanting more money for local governments and hospitals. Natalie Brand, CBS News, the White House.
And Calvo Select Care donated $32,000 to the Guam Medical Association, which in turn used $16,000 to purchase 500 reusable PPEs and delivered them to GMH. Additionally, $3,000 was used to purchase almost 500 bottles of hand sanitizers for the hospital. IT&E as well donated 30 mobile hotspot devices with 4G LTE data service to the University of Guam, so students who do not have internet access complete online coursework with high-speed connectivity. UOG has recently announced all classes have been transitioned to an online or alternative format for the rest of the semester. And finally, Ambrose Inc., Anheuser-Busch, and Kimberly-Clark donated 100 pairs of safety goggles and 149 cases of various level coverall garments to the front line. Sales manager Frank Shimizu Jr. stating, quote, "From the health professionals to the teams that have to enter contaminated areas, we wanted to help keep those heroes safe."
All right, thank you, Sabrina Salas-Mantanani, of course, from the one and only KUAM news team. And we'll have Nestor Lecanto, of course, with the session recap, and Adriana Cotero. She's working on a bunch of stuff. And how about this development with the Attorney General? I'm pretty sure we're going to talk about that later. But there was a release that came out yesterday from the Archdiocese of Gatineau, and we've got Father Paul standing by. But first, Bree, can you give us a little on that release?
Right. Effective immediately, all visitation ministries for the sick and the dead will temporarily be suspended in line with the governor's executive order, and this includes hospital and even home visits. According to that press release from the Archdiocese, this measure is taken trusting in the providence of our Lord and with the utmost safety of all people in mind. Priests will continue prayer services for the dearly departed during funerals. However, they will do so only at the grave sites and not in funeral homes or churches. All families must also observe the strict protocol limit of 10 persons in attendance. Archbishop Michael Burns asks everyone to be comforted by the love of our compassionate Lord and know that in time we shall return to normal.
And let's bring Father Paul onto the show. Good morning, Father.
Good morning. Good morning, Chris. Good morning, Sabrina.
And we wanted to bring you on here because you're the chair of the Archdiocesan Liturgical Commission, which advises the Archbishop on Mass and other items related to the liturgy. Also, you're a pastor, of course, of Our Lady of Lourdes in Jigo. Father, can you just tell us, maybe break this release down, and we'll just start with the actual funeral ceremony. So now police are only going to pray at the gravesite, not in the church. Does that mean that, or are we still going to be able to have the casket in the churches?
No, we cannot have the caskets in the churches, and really we need to put as a backdrop of all of this that ubiquitous mantra of stay home and stay safe, and the real heart of the Archbishop as our shepherd here on Guam is really, as the joint release mentioned, is the utmost safety of our people and also of the clergy. And one of the things that the clergy needs to understand is we need to not assume that we are all negative, COVID negative. We need to also make sure that we try to keep our distance, keep our social isolation. So the only thing that we can do at this point is to meet the family and the funeral party, and I'm assuming that it's going to be limited to 10 at the gravesite, and do the final commendation and the rite of committal right at the gravesite. Also, the priests are advised to don their PPEs, such as the mask and the gloves, just to keep everybody safe.
This decision was made in consultation, right, with public health?
Of course, yes,
Right? Okay.
always in collaboration with public health, and we need to always listen to the experts.
And did public health inform you that they suspect that there have been some deaths that are COVID related?
Well, I think the one lesson we need to learn is the Iglesia de Cristo Church. Where people gathered in the church, and so someone was infected. It only takes one person to infect a whole community. So, with that in mind, we need to also be very, very careful in any kind of church, especially as pastors, to protect ourselves, but also to protect the people.
Polly, what about the visitation of the sick and dying? That's not going to be happening, and can you kind of explain, is there going to be anything else offered, maybe with a video call? I mean,
yes, definitely. We encourage the pastors to use the social media equipment that we have, such as FaceTime or a phone call to pray over the sick person. The one thing we cannot do really is to anoint the sick, and that's very unfortunate. But again, with the backdrop of keeping everybody safe and saving lives, this is what we need to do at this point in time.
Polly, it's a tough question, but I got to ask it. We go through these rituals with the funeral mass, with the anointing of the sick and the dying, and it's a crazy world, and we're having to deal with all these mitigation measures, obviously, to avoid the spread of COVID-19. But in believing in these rituals and these ceremonies that we do, and now we're not going to be doing them, what does that mean for the souls of these departed and those who are sick and dying, Father?
Well, prayer is very, very important, and of course, the highest form of prayer in the Catholic Church is the Mass. And so, priests, even though they're celebrating masses in private, we are constantly offering up, prayers, especially for the faithful departed, we pray for their souls. We don't necessarily have to be there in person, but with prayer to God is very, very, very powerful. And at this time, that's what we are doing. And even celebrating the masses, live streaming, at least we have that connection with the faithful, reminding the faithful to keep, steadfast in faith and persevere in this dark time of our lives.
I was just wondering if there was something that triggered this from public health to come to the church and ask that this be discontinued.
I think, especially here in Guam, sometimes the voice of the church is probably a lot more powerful than the voice of the government. And people, especially the faithful, tend to listen a little bit more probably to what the pastors have to say. And of course, it may sound very apathetic, but again, we keep reminding the faithful that this is for our own good, for the good of the community, to really contain the spread of this virus until we can eradicate it.
Has there been an increase in requests for these services? Has there been a lot of death? Okay.
Yes, and we of course we console the family. We talk to them over the phone. And our people are very amazing. They're very resilient and they're very understanding. So they do understand the reason why we cannot have a mass in the church. They do understand the reason why we cannot really go into the funeral homes, because there are other families that we have to serve. And so for the priest protection and serving the other families, and also for the families themselves, we need to make sure that we practice this, social distancing and social isolation. But consoling the family is very, very important, and we can do that through other means, such as social media or FaceTime. But at this time, we really would like to thank the faithful for being very, very understanding in why the priests cannot go to their homes, cannot go to the hospital, cannot go to to the funeral homes to greet the body.
Paulie, you said that the faithful are being understanding. This release just came out, mid-afternoon yesterday. What kind of conversation have you had with, parish members and other faithful about this latest decision? I mean, this is just the next thing that could have been taken away from the Catholic faithful.
I believe that the people were probably expecting it. The church, again, always listens to the experts. and the people were expecting that this was going to happen. Many probably are not very happy, but again, we need to remember that this directive is for the good of the community.
Okay, Polly, is there anything in closing that you wanted? You know, last time we had you on, you prayed with us, and I don't know if it's too much to ask. Again,
can I just ask something else?
Okay,
I'm sorry. I know that you guys earlier this week, you had buried 2 of the unclaimed bodies, right, at the Guam Memorial Hospital. Are there any more unclaimed bodies at GMH morgue?
Not that I know of. I haven't heard from the Arimathea Society about any more future burials, but that doesn't mean that there aren't going to be any more coming up. And I'd like to really thank all the donors that really came through, especially, building of the coffins for the Vice Mayor of Chico, and also the other donors who really were very, very generous in helping us in trying to bury the dead, especially those who are unclaimed.
And Father, just for clarification, with this directive from Public Health, again, you said there's an increase in requests for. I'm just wondering if there's been an increase in deaths during this COVID time, or was it a directive based on this trajectory that we've been hearing about?
I believe it's based on the trajectory because we haven't, according to the Department of Public Health, we haven't even reached our peak yet.
Right.
So you could imagine, what's going to happen if we don't stop, we don't stay home anymore. You can imagine if we continue to just to congregate, have social gatherings, because we need to stop the spread. That's really the main point of the government and the Department of Public Health. Stop the spread by staying home and being safe.
Okay, so it hasn't been that you'd seen an increase in deaths and these reports.
Thank God, no.
Okay.
But that's not to say that we won't see any.
Right.
No. And then the only reason why I asked that is because in New York City, they're now counting deaths of people who have had COVID symptoms but died before they could be tested.
Right, and this is something that we want to kind of ask about going forward, because if they're doing it in New York, we're wondering if that conversation has been had here on Guam.
I am still waiting because, personally, I haven't seen my mother for a little over a month. And I don't want to go see her because how do I know that I'm not positive? How do I really know that if I'm not really tested? Because, you can be asymptomatic and people need to know that. Because you can be carrying the virus, and just because you're not showing symptoms doesn't mean you're negative. So we need to always assume, and that's not a good thing, but just to be on the safe side, assume that you're positive and keep yourself safe, but keep others safe by donning all your PPEs and making sure that, whatever virus that is that you're carrying is not spread to others. So I think that's a good mindset to be in as far as this is what we're trying to tell our priests also. As much as they would love to see their communities come to the church, we need to try to encourage them not to at this time and not to have any kind of social gathering, especially around the church. Someone was mentioning to me the other day, maybe we should put the loudspeakers on outside of the church, because we do have speakers outside of the church so that people outside can be listening to the mass. They said, well, that will only be encouraging people to come and gather.
Right.
And we don't want that. That's exactly what we don't want. And we need to, as priests, we need to just try to assume that we are carrying the virus.
Friday, and this is just kind of some heavy news coming out, and a close friend of mine has just suffered a death in the family, and she sent me a message that hearing this news, it just broke them. We've already been dealing with the measures that are applicable to the funerals. People are having rosaries by Zoom. And so now this is just another thing
that's wonderful.
Right, yeah. So if you
I
could.
would like to say a prayer that I've always found very powerful, and all of us here in Guam are so devoted to Our Lady. It's called the Memorare prayer, and it was written by Saint Alphonsus Liguori, who is the head of the Legion of Mary, and it's a very, very powerful prayer, and I advise everyone to look it up, so that whenever you feel very down, you pray this prayer to Our Lady, who is so powerful, and always leans into the ear of her Son, interceding for all of us. So I like to pray the Memorare as I close. In the name of the Father, the Son, and the Holy Spirit. Amen. Remember, O most gracious Virgin Mary, that never was it known that anyone who fled to your protection, implored your help, or sought your intercession was left unaided. Inspired by this confidence, we fly to you, O Virgin of Virgins, our Mother. To you do we come, before you do we stand, sinful and sorrowful. O Mother of the Word incarnate, despise not our petitions, but in your mercy hear and answer us. Amen. Santa Maria and Carmelin, pray for us. The Lord be with you and with your spirit. And may Almighty God bless you, the Father, the Son, and the Holy Spirit. Amen. Be safe, everybody.
Thank you, Father Paul.
Thank you.
You're welcome. Thank you.
Okay. God bless you. Wash your hands.
Okay. Bye-bye.
Okay, bye.
Gets them every time.
Tried and true. 6:52. Sorry, Bree. I just like the praying. I
What? I
okay.
like to pray.
Okay.
Man. Can't believe you're calling me out.
I'm not calling you out. I just,
You
know.
are.
Okay. 6:53. Let's go over to the phones and get Dr. Vince Akimoto on. He just called in. And we haven't heard from him in a minute. Good morning, Doc.
Hi, Doc.
Hi, good morning, guys. Thanks for all the hard work you're doing. It feels like we're waking up to a good morning, and hopefully things will continue to get better through the weekend. The reason for the call, I think, is that we're walking around the island whenever we have a chance to get some fresh air and noticing that there really is a lot of people that are trying their best to stay healthy, get exercise. And I think as we, get through this together, there's still the recognition that there's a lot of work to be done. And, there's a lot of people that have not been working, and they have been, I think, been waiting to be told what to do that could, help our community move forward. And so, not to beat around the bush, but it is irresponsible of the director of Parks and Rec to let the facilities on Guam, which our people are using, be in such a state of disrepair that it just feels like we've abandoned our whole island. I mean, walking up to the Dedido Sports Complex, going to the beaches on Guam, looking at the schools, looking at all the recreational facilities on Guam, it's as if, the director of Parks and Rec just gave up. And I believe it's a new person who was brought in because the last guy couldn't get the swimming pools fixed. I'm calling out the director of Parks and Rec guy and saying, dude, if you thought you were going to come in and just sit around and collect a paycheck, just go away. You're doing a terrible job, and you're doing a disservice to the frontline healthcare providers. You're trying to get people healthy and keep people healthy, and then they have this trash to look at. I mean, so I don't know who the director of public health is.
John Birch. I believe the acting director is John Birch.
I think he used to be a teacher or educator. I mean, it is just terrible what Simon Sanchez High School, the front part, looks like. And he might claim that's not his responsibility, but if he's an educator, if he's somebody that cares about Guam, what's he doing? I mean, there is no social distancing issue at Simon Sanchez High School front yard. There's nobody there except stray booney dogs. And there's a school up in Gio, I don't know what the name is, but that place looks like it's worse than Simon Sanchez. So I'm calling out the director of public health right now. He needs to wake up, get moving. Nagasgas, Guam, we're going to get out of this. And I don't want people to wake up and get going and realize that we're in worse shape than we were before the coronavirus. There are 5,000 people, government of Guam employees, getting a paycheck, getting benefits. You could use them, and we challenged you to do this when you first came in, Mr. Director. What are you doing, and why are you not doing something? We have a whole weekend where people could be working, so get out of your bed, do something. Scratch yourself if you have to, but we need to get to work. This is humiliating that people are working so hard to save lives, and then when they go out to the parks, to the villages of Guam, it is filthy out there. Shame on you.
Well, that definitely came out of...
Are a wreck.
Yeah.
The Parks and Rec are a wreck. And if Mr. Birch is the guy that's responsible, he's getting a big paycheck to watch it be a wreck. So he needs to wake up.
Well, I got to thank you, Doc, because you've been on this message since the beginning. Yeah. And we're, a month into this, and you're still saying the same thing, and it's unfortunate.
Well, we're going into a weekend, so hopefully we can make it up. 'Cause Monday morning, I don't want to wake up and the parks on Guam look like this, because we're going to get out of this. People are going to get back to work. People are going to get back to playing with their kids and being with their grandparents. But there is no excuse for Government of Guam directors to be sitting around waiting to be told what to do. So if you're waiting for me to say it, get up, get moving. Let's get Guam better. I mean, the schools need to be getting ready. I mean, at the very least, we should have summer school. So, again, your vacation's over. Get up and get to work.
There you go. Fire up the riding mower.
Have a good morning, sir.
Thank you, Doc.
Thanks.
Bye-bye. You too, Bree. Bye-bye.
Okay. There you go, Dr. Vince Akimoto. And his message for the day, you kind of on the peripheral of COVID-19. But, yeah, the governor said the parks are closed, but you can go there for your individual mental and physical exercise. And, I mean, I think he's got a point. There's 5,000 non-essential government employees that I think are becoming a little more essential every day.
Yeah.
As we get deeper into this, mandatory social isolation and lockdown. I mean, he has a good point. They could. I used to cut grass for a living, man, and it's not there's a way you could do it by yourself. There's a way you could have one guy in a bush cutter off on the side. You get the riding mower. So yeah, maybe we'll get the Parks and Rec director on the line. Maybe we'll see. But good points there from Dr. Akimoto. It's 6:58. We are KUAM FM in Hagatna, Guam. It's the KUAM News Takeover of Guam's favorite I-94. Coming up, we got Dr. Hohen Wen to call in. And then also this morning, we're getting the Assistant Secretary of the Interior.
For Insular Affairs.
Intergovernmental
Affairs. Douglas Dominich.
Yeah, so he's going to be calling in at 8. Also expecting to hear from a couple senators as your Guam legislature wrapped up their emergency session by passing a few bills and not passing, noticeably, some others. So it is Friday the 17th of April. Good morning, Guam.
Hoffaday, I'm Jonah Goncharfris, Senior Producer for KUAM News. And I'm sure you are probably tired of hearing it, but I'm going to say it one more time. I urge you to please, please stay home. To protect your parents, grandparents, manamko, loved ones, neighbors, hell, the entire island. Stay put, stay home. Make sure you wash your hands, practice social distancing. I know it's hard because we miss hanging out with family and friends, but the sooner we do our part, the quicker we'll get back to our regular routine. We will get through this. Thank you, stay safe, and stay home.
Hafade Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Be healthy. Be informed with ITD.
Working hard to keep you safe. Wash your hands. Stay home.
Hi, this is Ryan Clowers from Crescent Fitness. This is a quick public service announcement. We want to remind everyone, please just stay home. Go kick back in your pajamas, like we're doing. Go spend time with your kids. Go do the things that maybe you've been kind of just forgetting for a while, go get a workout in. But the big thing is, please stay at home. For the sake of your kids, your family, and your future generations, please stay home. Evan, what about you?
Stay your butt home.
The soldiers and airmen of the Guam National Guard are working hard to fight this coronavirus battle. You can help us win this war. Please stay home. Saga Gigimatmizu.
Self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafade Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
takeover of I-94 containing COVID. We are just all over. Streaming live on the KUAM News app, of course. KUAM News Facebook. We're live on the show. Good morning.
Hi, everybody.
Got Jason Salas and Joser behind the box over there, doing things up at 7:07. And just something that the mayors have really been asking for, and they've been doing it on this show, going back almost to the beginning of this COVID-19 crisis, is the mayors have been asking public health for a breakdown of COVID-19 positive patients by village. And KUAM News has been able to obtain a breakdown list that actually, this is what it breaks down a list, the number of COVID-19 positive patients per village. And we wanted to start by getting Mayor Louise Rivera of Tamuning, Tumon, and Harmon. And you guys want to listen up because she's going to go ahead and come on the show. And Mayor, just to confirm here, you guys were given the list with the breakdown of the villages, and we're looking at it, and we're seeing that Tamuning has 15 COVID-19 positive patients. Can you confirm this, Mayor?
Yes, that is what I was told yesterday. They did give us the breakdown of how many in each village, and I was told there was 15 in ours. And I asked the question of, are they all in isolation? And, because we have the hospital here in Tamuning, and, of course, the government isolation is one of the hotels. Mm-hmm. So that's all nearby. But then how about, with all the other villages, they gave us numbers of those in their village, so I was asking, are they from the village and then put into Tamuning for the government isolation? Or, where are all these numbers coming from? And then we wanted to know the ethnicity and exactly what clusters they came from. Mm-hmm. What fundraiser were they talking about? Things like that. So we were told we were going to get more information today.
So are you guys having daily briefings now with them? What prompted this meeting? Because I know there was hardly any communication between mayors. This was a Zoom conference?
Yes, we had the Zoom conference with the Department of Public Health, Linda DeNorsi, and several of her team.
Mm-hmm. Did they give you a reason why they did not provide this information sooner?
The governor assured us that they would be in communication with us more. Mm-hmm. That's what we've been asking, and so we're getting as much information as we can, as long as they don't give out the name.
Right. And so, Mayor, we have obtained this list through a variety of sources, and we're going to go ahead and read it off to you and go by village. So, Sabrina, again, this is a document, list information we've obtained from several sources that the mayors have been briefed by the Department of Public Health and Social Services, and they've been provided with the number of COVID-19 positive cases by village. So you guys are going to want to listen up to this info. Sabrina?
All right. In Agania, there are 0 cases. Sinahanya, 4. Orat Chalanpago, 5. Jotnya, 5. Telefofo, 7. Inarahan, 2. Umatic, 0. Agate, 3. Santa Rita, 1. Pidi, 1. Agania Heights, 5. Mongmong Totumaiti, 1. Barragata, 13. Mangilao, 14. Jigo, 13. Dedido, 42. Tamuning, 15. Maritzo, 2. We were still waiting for Asin Maina. That's still pending. But when you total this, it equals to 133.
Right, and then the two were homeless.
Yeah.
So we haven't been able to actually. I spoke with the Asamaiana mayor, and he said he didn't make the meeting, so
Yeah.
he didn't get. So Mayor, what was the reaction from your colleagues when you guys got this information after asking for it, after hammering on the administration, after request after request of for them to be transparent with you guys?
Oh, okay. Well, we were asking to, if they can at least give us the breakdown of the areas, because, we all have big areas. When they say 15 in Tamuning, I would like to know how many are actually like from Tumon or Harmon, or, are all the 15 there at the Days Inn, or is some of them at the hospital, because the hospital's in Tamuning.
Right.
So I don't really know. I mean, I only know from the families that come and tell me, because we still assist them with getting food to them and their families, because, they're not allowed to go out, they're under quarantine. So, we want to be able to help not only the families, but, the government, to make sure that they are being monitored. If there's something they need, they just need at the store down the street, we can be able to help them, instead of them sneaking out. Because, I was asking, do you have someone there monitoring them 24 hours? Because, I know like some of them would go out and smoke, or, walk out to the trash bin. Some of them live in apartments, condominiums, so we need to know, that's what we want to do. We want to be able to help. And we're not asking for the information for nothing. It's not for us to go and spread and,
right.
Confirm rumors. But, when especially our people are going out there giving out lunch plates for kids and for the seniors, we want to be sure, that they really, there's a table outside for them, that we can put it on and not wait for them to come out and answer the door and, receive it from them, because there's no sign that says, this is there's a positive, or this house is under isolation, or, anything like that. We don't know. And so that was our concern. But, we totally understand the HIPAA regulations and not to give names, but, just so that people too are assured, like, what area to look out for, be careful, because, they shouldn't buy food in that area because of, that there's like 15 over there, and how it's airborne.
Right. Yeah.
We don't know what to expect. So, we're, like I said, we're all concerned and just trying to help out.
Right. But Mayor, I think this is I don't know if it's too late to consider it a win for, you guys and the people in your villages, but, I'm thinking, especially in Dedido, where we've got the information of 42 positive COVID-19 patients there, that it's going to make people take this a little more seriously if they know that it's in their village. And I think that was kind of one of the goals that you guys had.
Yeah. But then again, see, are they from Dedido, but now isolated in Tamuning? That's what that is still my question.
Right. And so, Mayor, are you guys having any other briefing here? And so this information that we were able to obtain, we were told that it was preliminary, in that they were going to go back and then provide the number of, other information like recoveries, I guess, and then deaths as well. Is that, can you confirm that, Mayor?
They did tell us that they were going to get us the other information today. It'll be part of their briefing too, I believe. That they do daily now. So and then we'll have access to their dashboard online to see the breakdown of everything.
Okay. Your final thoughts here, Mayor, before we...
I just wanted to ask, was there any other conversations about what they were going to do for the homeless population?
They did well, yesterday was our meeting with public health. The day before, we had our meeting with the governor, and she did assure us that it is in the planning. They have something already that they're going to be ready to roll out, work on it right away, because when she mentioned it would be another 2 weeks, we're like, you want to stop the spread now. Why are we waiting for another 2 weeks? What is the plan? And let's move forward with it. We need it now. People are there congregating around the parks, on the streets, different businesses outside people's homes, and then we also brought up the thing about, they shut off the water at Ikaw. I'm a top hang, and a lot of everyone knows, around here that there's a lot of squatters in these abandoned buildings, and
what, Mayor? Why do you think it's not it doesn't seem to be a priority? Because I'm in constant contact with people from the Homeless Coalition, the people who kind of have always led the movements to deal and interact with the homeless and to give them assistance and services. And I mean, they kind of seem frustrated, and their response is thanks for caring, because they're not seeing that, and we ask about it, and every time we ask about it, you're right, it's still in the works. It's still in the works. It's still in the works.
Yeah, and it's sad whenever I get that answer, and I always say, you know what, that's been the answer ever since. Please have something now, because there's people right now that are suffering and looking for a place where they can get water and just a place to be safe. So a lot of people are staying outside businesses that have security, because it's for their safety too. It's just really unfortunate that, they cannot be with family members, living with other family and friends. They don't want to impose. There's a lot of good people out there. It's just that they're homeless. They don't have a place to go. And so that's why we've been asking for a place. There was mention about, there's going to be a tent city. I have another a business person that came up to me and said, we're donating containers. We're just waiting for them to say, a location where we can put it. There's a lot of people out there that want to help. Right. But, we're all just looking for direction from the government.
Yeah, it's kind of frustrating that there's a lot of people out there that want to help, including you and these people who advocate for the homeless and these businesses who want to donate things, but they're all just sitting around waiting for the government to get on board.
Well, hopefully we get an answer today to say that the place is open. We've given our suggestions, in different areas, one way in, one way out, they'll be safe. There's showers down there, or, making sure that, they can take care of their hygiene.
Right.
So where did they say they were looking at?
I know that one area that was suggested was the Paseo, the Loop, that whole area, because, you drive in, you drive out, and there are showers there, and it's a gated place, the Paseo Stadium, baseball field, and it's beautiful. It's, the beach is there, so, and then of course all the shelters that were put up down there. I mean, we just need a place.
Okay.
We need a safe place for them to go to.
And so the plan is to roll out a plan in about 2 weeks.
Well, they said 2 weeks. She said that she was going to have that taken care of right away. Tony Babauta assured us that, okay, he has his orders to go and make it happen. So we're excited to see and know when. So we're all looking out for that.
So we're going to wait till the projected peak of all this to do something with the homeless. That's very nice.
No, we're really hoping to have something today or real soon.
Okay.
Right. Okay. Well, Mayor, appreciate you confirming this, and keep us posted. You got my number. You let us know what other kind of briefings you guys have. And again, I want to. I don't. It's kind of weird to congratulate you guys, but you guys have been calling for this information, as many people, not just the mayors, people of Guam have been asking for this, and so we're very fortunate and very glad that we're able to obtain it. And thank you for confirming it for us.
Okay. Also, to let you know that when we did have our briefing with Public Health yesterday, they did mention about having people apply for the SNAP program,
Right.
those that are in need of assistance. So although our office is closed for walk-ins, we are accepting phone calls and, trying to assist them as best as we can over the phone through WhatsApp or email, for documents, for them to register and get their verification of residency.
Right.
And then if people absolutely don't have a computer or a phone, or they just need assistance, we can make arrangements for the, Windows service also.
Mayor, I spoke with Linda, and she had said that she discussed with the council president, Deputy Mayor Melissa Savares, that there was going to be some way where public health can coordinate with the different mayors and then somehow obtain the verification forms from you guys directly. Is that accurate?
Yes. So what we'll do is if a resident requests for verification and they want it for public health, we'll send it directly to public health, and then we can also send them a copy if they want a copy too for themselves. But to assure them that it will go to public health, for as part of one of their required documents.
Okay, Mayor. Well, thank you so much, and keep us posted if you get any additional info or any more briefings today. Okay.
Okay. Thank you, Chris. Thank you, Sabrina.
Be
Enjoy
safe.
your day.
Be safe. Wash your hands, Mayor.
Yes, I will.
Okay.
Adios.
Thank you, Steph. 724, Bree, the comments just blowing up. And again, if you're just joining the show here, KUAM News has been able to obtain and confirm the information that we have obtained with, the Mayor Luis Rivera of Tamuning, Tumon and Harmon. This information was presented to village mayors yesterday by the Department of Public Health and Social Services, and it is a breakdown, a village-by-village breakdown of COVID-19 positive patients. Sabrina?
Okay, for the village of Aganya, 0. Sinahanya, 4. Orat Chalampago, 5. Jotnya, 5. Telefofo, 7. Inarahan, 2. Umatic, 0. Agate, 3. In the village of Santa Rita, 1 confirmed case. PD, 1. Aganya Heights, 5. MTM, Mongmong Totumaiti, 1. Barragata, 13. Mangilao, 14. In the village of Jigo, 13. In the village of Dededo, 42. Tamuning, 15. And in Maritzo, 2.
Oh, there you go. We got the graphics. Hey, can we give Jay a hand over here, our digital guru, Jason Solis, of course. Good job, Jay, for getting that info out there on those graphics. And this is something the mayors have been asking for, for several weeks, Jay.
And, I know the comments, everybody kept saying, can you bring that up again? We're going to leave these up, throughout the show and everything like that. So, and most importantly, for those of you, most people are watching this on mobile devices, or if you're watching on TV, take screenshots, save them on your phone, share them to your neighbors, share them in the neighborhood watch groups, because that's a very effective way to get information out. Share them with your family and your friends. That's what we do. So, we're doing this for you guys. So thank you for helping us get the information out.
Right.
Yeah, well, thank you, Jason, for helping us get
and
the
as
graphic.
you heard from the Tamuning Mayor, Luis Rivera, they are expected to get more detailed information regarding these numbers that they received. Mayor Luis was wanting specific information. Are we talking about these are 15 people that actually live in my village, or are they 15 people that are at the government isolation facility at Days Inn? So they should be getting another briefing. I think she said, did she say today?
I think she did.
Okay. And prior to that, they had a briefing the day before with the governor, and I guess Tony Babalta was there, her chief of staff, and they were talking about the homeless situation, and that's another issue that the mayors have been asking about. What are we going to do about the homeless population? And she said that they want a plan, and they've been waiting for the plan, and so the possibility is that they may be doing something at Paseo. So I guess we'll all have to wait to get the information on actually all of this.
Yeah.
So.
Yeah, well, 7:27. Let's get Dr. Hoa Wen of the American Medical Center onto the show this morning. Good morning, Doc.
Hey, good morning, guys.
Good morning.
So just real quick, we catch up. Can you just give us your interpretation of the last few batches of testing we've done? But first, I kind of want to start with, we've seen in these press conferences, the governor and her team continually talk about how we are expanding our testing capacity. And yesterday we tested just 12 people for COVID-19. So how does that add up? I know you're on the physicians advisory group, so we kind of wanted to get your take on that, Doc.
Okay. Yeah, we are expanding our testing capability, but right now we have, I know GRMC have their machine almost running. They promised by next week. DOS also probably sometime next week. So that's the ramping up the testing the capability. And we just received from FEMA two Abbott rapid test, which is the very, very nice test. It takes 2-3 minutes. And so one is currently situated at GMH and the other one at Public Health. And we're planning to move that to GMC in the near future. We have the device, but they only send out along with that 200 kits for the two device. So again, is the number of tests that we can run, but we are, I think, getting in more kits to run on those Abbott device at GMH and will be at GMC, but shortly. That's what the information we have from last night. So once we have GRMC on board, DOS on board, Public Health, and along the two machines, you can do a lot of tests every day, probably in the ability of 100 to 300 a day at least, or more. But right now, like since the machine is here and they're working hard to get everything in. It's just the machine itself, guy. It's the media, all types of chemical, everything to make it run. So they are working on it. And by next week, you should have a different picture now.
Right. And, like we mentioned, there were only 12 tests that were run at Public Health. Prior to that, without having the Abbott machine over at GMH or GRMC, they were running an estimated 40 tests a day. And so I'm just kind of curious, why did we stop doing 40?
There's like I say, there's a lot more involved in just testing right now. I know the VPM, the transmedia that we use to swab people's nose are in shortage also. Okay. So so those are coming in, in the very near future. So you'll have the VPM to swab people. It's kind of hard to run the test when you don't have the transmedia.
So the answer is that we are in short of supplies and test kits.
Yeah, I know we're in short everywhere. Not just Guam. So we are trying to get those things in, especially this Abbott device here. It's really we're going to try to order a lot more. Unfortunately, those devices can only purchase through the lab or through the government. No private entity can order those. And they only ship it within the United States continental, not to territory. So I know the speaker and everyone is trying to change that. So we can get more device to Guam.
Right. And I really appreciate the transparency, because a lot of the times we get these press releases and it's like, this is all we did.
Yeah,
okay,
no explanation.
So that's why it's kind of frustrating.
And now we don't got to waste one of our two questions at the press conference. So thank you, Doc.
Yeah, that's a key here. I mean, they are ramping up. I mean, they look at every which way. But we just like anywhere in the United States, even New York, they are in shortage of supply. So but a lot of entities here, like I say, GMC, DOS, and Public health, they are stepping up, and they can only get what they can get.
Right. But GMH, they ran tests through this Abbott machine the day before yesterday.
They did.
So they just don't have the test kits to continue running them?
We have, like I say, they have 200 out of the 2 machines, and that's all that they have right now. So I know they run upward of 50, 60 already. When public health are using those Abbott device to run the kit. Yesterday they're not running the other kit because they short supply.
Okay. So just to recap, Abbott machines are GMH. They're moving the one from Public Health over to GRMC. Then GRMC also has a Gene Expert as well as Public Health, but they're going to move the Gene Expert from GRMC to Public Health.
But for right now, just because the Gene Expert is not up yet, it's not. It just sit there at Public Health. So at GRMC, they see a lot more patients walk in the emergency room. So temporarily, it makes more sense to run more tests at the emergency room. They open 24 hours a day.
Right.
Yeah,
that was the point that Dr. Cabrera made yesterday.
Right. So temporarily, they're going to move the machine over until Gene Expert is up, and then they move back to Public Health. So
the Abbott.
The Abbott, because right now we try to use as much as possible, and it doesn't make sense to sit there and run during the working hours and not run 24 hours a day.
Yes.
So, we're going to try to move it to GRMC temporarily at this point.
Okay.
Right on.
When do you foresee us ramping up everything?
Everyone says in mid next week. Like I say, it's all about the timeline, the shipping that's coming in. Their machine is ready. It's just now to get everything else to come in for the machine to run. So it's ready. It sits there until the supply come in. They start running it.
Yeah, I know. We've been waiting for those 4,000 or so test kits for the Gene Expert, I think, because Linda's been talking about this for 2 weeks. So that takes a while.
I understand that they all fully ready. They just need those supply to come in, and they are waiting. They've been doing a little bit of test here, a little bit of test there to calibrate it, so it's ready.
Doc, there's a question here on our Facebook stream about the recovered patients, and is there any are they retested, or it's like you do the what the CDC says? Okay, well they haven't shown signs or symptoms for X amount of days, so they're good.
No, we have. I think they only retest one, but I don't think they retest all the positive COVID yet. There's a lot of talk about this rapid kit test from Saipan, and we tried to beat up our head yesterday on how to implement this thing. You cannot just buy them and just run them insensibly. You have to do it responsibly. So. And the unfortunate thing about it is that we cannot find any one of those things on the FDA list of approval, and right now it's not approval. So if you start using it, you're going to lose some federal funds. So we try to be somewhat creative on using this thing. We're going to try to get approved this morning to use to kind of do some studies on certain groups. I think Public Health will release this information for everyone that, they break it down certain ethnicity, like the Micronesian, the Chamorro, the Filipino. So we kind of know what percentage and where they're coming from. So we're going to go out and try to use this kit and do some study for like cluster, like close contact, those positive, the symptomatic, those are asymptomatic, and try to get a better picture using those kits as a study, not as anything else.
For like diagnosis. It's more for surveillance.
Yes, and try to narrow it down to how widespread it is out there in the community. So we're going to try to get approval from working with, from the government, working with UOG and everyone else to try to make this as a study rather than diagnosing anything else. So they are here on an island, so we're going to try to make the best out of it.
You're talking about the Solgent representatives are here on island?
Yeah, I mean, I'm not sure which kit they have. I know
The Solgens are the rapid South Korean test kits.
Are these the same ones that the NMI has, Doc?
I'm not quite sure. MD Wholesale and certain wholesale don't have them. They are in the possession of custom at this point. We're going to try to use those as a study. Like I say, I mean, we know what subgroup it is it belongs to, and it's interesting to know. The Micronesian is very little, only 2. The question is, why only 2? So maybe the travel is not there, and so we're going to try to do some contact and see if we can kind of figure out well, who's out there, the carrier, and who's out there is asymptomatic, but they have the virus. So, like I say, this is a study, guys. It's nothing else that we do is done by the government.
So it's not a dead issue.
No, it's not a dead issue. We try to use it as much as we can. I mean, there's we cannot just really sit there and waste those things and get criticized. So we're going to try to be, like I say, creative and do some study out of it.
So a wholesaler brought these test kits in from South Korea. They were confiscated by customs, and now the government's going to use them for surveillance purposes?
Yeah, I mean, we're going to try to...
Did I interpret that correctly?
Yeah, but the reason is, Sabrina, a lot of people are trying to use this kit, and the most dangerous part is that, they have a false negative. So, I don't want to test someone, a patient, and say, oh, you're negative. They have to sign a consent form, understand that negative doesn't mean anything, because you don't want to use this kit as return to work things and return a person to work and infect the whole place. So the reason that it comes to number 1 is not FDA approved. Number 2 is that they have to have certain criteria very strict out there for the physician or provider to use. Because we understand that there's some false negative out there that can impact and make this virus ramp again.
But so how many? I'm just curious. How many of these test kits do you have that were confiscated?
I think the number is from multiple sources, around 3,000.
3,000 confiscated test kits from South Korea that are not FDA approved that we're going to use for surveillance.
Yeah, it's not like, like I say, it's for study, okay?
Yeah. So surveillance isn't considered study?
Yeah, it's a study, but we have to be, like I say, work along with UOG, but they're going to bring the paper, so that way we can prove that it's work, and also work with public health to try to, do some PCR testing to validate, those test kits also.
Are there any other medical supplies or equipment or anything that has come in that was confiscated by Guam Customs in quarantine that the government is now going to use?
No, I tell you, I mean, I'm not sure that I know the letter that come out into the North Sea is a little bit confused, but that's not a purpose of the government to confiscate anything from any clinic or anything like that. You know, they mainly need to know what's on island.
Yes.
Okay, I mean, come on. We have to know what's on island. Because at this time, everybody buy everything out the book, and you have no accountability, just like how many car you have on island. What type of car you have on island. So you have to know what's on island,
right?
In case if we shorted somewhere or someone uses something they're not supposed to use,
right? And then also, Doc,
for
Doc, wasn't there also a concern that people are bringing in things that might be making false claims, or I mean, we saw this in dengue where they were seizing stuff that repellents that didn't fall and meet the EPA guidelines. It's kind of a different issue now, but is that also happening where they're maybe seizing stuff that makes claims that aren't validated?
Yes, Chris. That's the part where it's so important to know what's fake and not fake. So the government have to be aware of what's coming into the island. People buy things from China, from everywhere that they can find from eBay, from Amazon. So those things is that real? Does it hurt other people? Or people will say, "Hey, this kid is good for you. Test at home." And if I'm the patient, I'm a person, I say, okay, I'm going to buy it from you. I mean, those are detrimental to what we try to do right now is contain the virus. So that letter is not mean so that they're going to confiscate everything out of the clinic for the government. Come on, that's ridiculous. Don't think it that way. So they are trying to control what's true and not true, and for people to use things responsibly. Okay?
Right. Doc, I wanted to ask you this, something we picked up nationally from New York. The national death toll from the coronavirus has risen sharply, now up to around 31,000. And that's partly because New York City is now counting deaths of people who had COVID symptoms but died before they could be tested. Is this something that we are looking at on Guam, Doc, or is this any part of this applicable to our island?
You know, as you see the spread out, the number they come out and for public they have to release is that you have some COVID, clinical COVID, right? I mean that those guys test negative even to the PCR, but they have all the symptoms and the X-ray, the CT show that they have COVID-19. So even those FDA-approved kits that we run, some of them turn negative, but they clinically COVID-19 positive. Okay, so yes, we are counting the people that pass away for any reason, and some people that have negative tests that is clinically positive. So we are counting those things. You know, we even if you pass away for any reason, they're going to try to test to make sure that they're not COVID related.
And so, Doc, when we do that, if we get, because what you're saying, I just go with this clinical diagnosis thing. So basically what you're saying is that we can get a false negative out of the test that we're currently using right now?
Yes, we are. You know, we see some case that, you know, it doesn't make any sense. You know, when the chest X-ray, the CT is just classic of COVID-19, but they turn negative and they act like COVID-19.
Right.
You know, but the test is negative.
Okay,
and
so
it's not one, it's multiple.
So let me ask, if we have people who pass away and we suspect that they're PUIs or they otherwise need to be tested, if we test them and then we get a negative, how do we have any faith in that test result? And then if it is a false negative, do we then count those deaths towards our COVID-19 casualty count?
You know, you never get anything 100% in any test. You just have to make an educated guess, and then if you do think it is, then you have to do the tracing, the contact, and all that kind of stuff for all the people around that person.
So let me ask you, Doc, that being said, do you think that more than 5 people have died of COVID-19 on Guam?
You know, we have 5 confirmed deaths in Guam. And I'm not sure if they truly die from COVID alone, because all those 5 people have multiple comorbidity, and you know, so even if they come in without COVID-19, there's a risk that they pass away also, and also that those people make the decision that they don't want to be interfere regarding like DNI, DNR. So without intubation and get these people on the machine, it's impossible for anyone to stay alive if they don't have that chance.
So what was the answer there, Doc? Do you think we have more than 5, COVID casualties? And I understand what you're saying.
There's a possibility there, Chris, that there's more than people die out there from COVID-19 that we don't know.
Okay, I guess that's something that we're going to have to track down.
Yeah, but is that a lot? No, I don't think it's a lot, Chris. I mean, there's probably less than a handful, and like I say, the most important for those people is for you to identify and trace the contact, so that way we can isolate and quarantine people at home.
Okay, Doc. Yeah, we saw in New York that that was a thing, for lack of a better term, and we wanted to see what the deal was here on Guam. So definitely appreciate.
Yeah, but you know, every day is new, right? What I tell you now, the next day is totally different. So you know, so what I tell today is really just today, and we learn every day that this thing is different. So again, is a big thing. And I just want to tell the public that we met with Mr. Ed Byrne also from Department of Administration. They're going to try to work with the Department of Labor just to try to come up with a certain plan for the people, for our worker employee out there that lose their insurance in the next few months. Because that's going to be very important. That's another wave of non-COVID patients that will hit the hospital. So they're going to give us an answer sometime next week.
Okay, Doc, I know you're busy. Want to thank you for your time. Always very, very valuable to speak with Dr. Hoa from American Medical Center.
Okay,
Thanks.
have a good day.
You have a great day, Doc.
Be safe.
Wash your hands. Hey, and I got to ask you.
You going on your boat?
Yeah, did you catch anything on Easter? Because you told us you were going to go on your boat.
Yes, I am. I was. I was on my boat, but the fish also in the quarantine. I only catch one.
They're in isolation, Doc.
Oh,
Thank you, Doc.
Thank you, guys.
Okay,
Okay,
bye.
All right. Okay. There you go. Wow. Hey, watch and share the show. We are just dropping some bombs this morning. We've got that village breakdown we were able to obtain. And again, it's just in the spirit of transparency. That information we've all been wondering, and definitely felt that was something that the public, as well as the mayors and their staff, needed to know. Jason?
Okay, you guys' comments are fantastic. I love the fact that you're discussing with each other, that you're sharing it outside of Facebook. Once we start our TV show portion on the back half at 8 a.m., I'm sure you guys are going to do a lot of that. So thank you guys. We do have a comment that I wanted to shed light on, though, Chris and Bree, from Gemma SG. She's one of our top fans. And she has something that, honestly, I thought about. She goes, can we use Cocos Island as a quarantine resort? It sounds funny. It's creative thinking. But, if you think about it in history, the island of Molokai was originally used to house leprous people. The continent of Australia was originally used as a prison colony for the British and everything. And I've seen this pop up a couple times. I saw it on Twitter, and people were like, not to say that we're going to completely excommunicate people, but if there is a quarantine facility, could we actually identify Cocos Island as a place to quarantine or to isolate people who have the illness? So that's interesting thinking. So I like what I'm seeing in there. So you guys are doing a great job on the comments. And for those of you who are asking, yes, we're going to bring the graphics up throughout the show. We would hope that you guys would continue to share that, and thank you for helping us out with that. So we're going to keep going a lot, because the visualizations are really, really good. People
Let's
like
go ahead
seeing
and
it.
go over that list
Okay.
again. All right, and this is the breakdown of village by village positive COVID cases. It was released to village mayors by the Department of Public Health during a Zoom briefing yesterday for the village of Agana. Or actually, let's go to
let's go to
Dedido Mayor.
let's go to Dedido Mayor Melissa Savares, who Mayor. 42 confirmed COVID-19 cases in Dedido. Let's just walk back when you were presented with this information. What was your initial reaction, Mayor Melissa Savares? Good morning.
Hi, good morning, Chris and Sabrina. Well, of course, the numbers are high, but like I had mentioned to our team, I said that's 1% of our population. We have 45,000 people, so it's alarming, but with a large population, it's expected. I'm glad that many of them, more than half of them, have recovered. So they are back at home and really being careful. So, at least that's the information that we actually have been wanting from the Department of Public Health, and we're glad that Linda and her team put that together. There's some other things that we're waiting for is, by ethnicity. That's kind of sketchy where they can't do that. But other things are, the number of positive was what was given to us. We want the more clearer number of how many recovered out of those positive.
Right. Yeah.
Yeah.
And then also, Mayor, are you anticipating getting information on COVID-19 deaths by village?
Yes, we asked for that as well. So we're waiting. That's why they haven't finalized the dashboard, because we asked them to put the number of deaths, the number of recoveries by village, and the ethnic. Oh, and then what we did ask, Dedido is a large community. So if they, not necessarily by street, but at least, identify how many in Dedido are from Estumbo, how many are from Guanteras, how many from Machechi. So, we kind of have an idea of what part of the village they were coming from.
And what have your residents been saying, Mayor?
About the...
Well, I guess they're just finding out this morning. Have you gotten any calls already? Because we put this out about an hour ago.
No, we haven't received any calls yet about the numbers. So I guess when, as soon as we will hear more later, I guess as the day progresses.
Can you just walk us back? Because, I mean, Mayor Hoffman, Mayor Louise, Mayor Ernest of Molesta, Mayor Rudy Matanani, Mayor Jesse Gogui,
Ernest Jarkloff,
Mayor Ernest, you guys have all been asking for this information. So maybe just walk us back. How did it go from continuously asking the governor's office to be transparent to them becoming transparent?
Of course, the concern was when the numbers were issued last week by where they contracted this, and of course the alarm was set off when it was identified that 11 were coming from Iglesia de Cristo. Well, Iglesia de Cristo is from Dedido, in Dedido. How many of those congregations that were affected actually live in the village? How many live in Tumuli? Where in the village are they coming from? The concern that Mayor Hoffman had was, it's identified 3 coming from that contracted this from the Sinohanya Senior Citizen Center. We, as mayors, are continuing to get the hot meals to the seniors that are registered in our community. Of course, that's what brought the red flag. We've been asking, and so because after those numbers went out and identified the areas of where they potentially may have contracted COVID, that's when we had our meeting with the governor, and we expressed that, we've been asking this for 3-4 weeks already, and we were only given numbers by region, yet JIG releases the numbers by area where they had possibly contracted from. So that's when Department of Public Health had got a hold of us and said, listen, we want to be a little more transparent with you. We've done a dashboard. Can we show it to you before we actually put it out online? And so when they showed that to us yesterday, we were satisfied. But however, there were questions. We still want to know, out of, like I said, how many of the 42 have recovered? How many of the 5 are from our actual villages? So that's something that they're going to finalize. And so I talked to them last night, and they're still working on some of those details. So they have to go back with the surveillance team. And then
so you would think that information would be ready to go, But
it should be ready by this afternoon, hopefully this afternoon, because it's about getting together with the surveillance team. They're still doing, checks on certain areas. And so once they get those final numbers, they should be able to send that out. And I've been in communication with Department of Public Health, so and their team. I messaged them last night again, and they said hopefully, as soon as we finalize the dashboard for what we requested, then they'll send it to us.
And this is going to be online, you said?
Okay, we'll put it online once we, they show it to us. Yeah, of course it's going to be online.
Okay. For everybody?
Yes.
Okay. There you go. That's cool. But you got it here first on KUAM News, containing COVID.
Okay.
And I think it'll be out at the briefing at 1:00.
Yeah, that's good.
Yeah. Could be, yeah.
Okay, Mayor. Anything else in closing?
When's your briefing today?
We don't have a scheduled briefing for today. We all get briefed like you do, okay?
Wow. So I'll see you at the press conference.
Okay.
Hopefully there's video today.
Oh, okay.
Okay, Mayor. Are you doing okay, Mayor?
We're okay.
You all right?
Yes, we are.
How's the family?
Well, they're still there. They're at home.
Okay. Did you wash your hands?
All the time.
All right. Thank you, Mayor. Hey, thank you so much, Mayor.
Okay, you're welcome. Have a
Okay,
good
yeah.
one.
Take
Oh,
care.
Okay. 756, Guam's favorite I-94. It's the KUAM News containing COVID.
Want to go through those numbers?
Let's go through those numbers
Okay.
again, and then we're going to flick the switch and jump over to KUAM TV 11 because my hair looks nice today.
All right. In the village of Vigania, there are 0 confirmed cases. Sinahanya, 4. Orat Chalanpago, 5. Jotnya, 5. Telefofo, 7. Inarahan, 2. Umatic, 0. Agate, 3. Santa Rita, 1. Petey, 1. Agania Heights, 5. MTM, 1. Barragata, 13. Mangilao, 14. Jigo, 13. Dedido, 42. Tamuning, 15. San Maina, we're still waiting for the number for that. Maritzo is 2. And again, this is the information that will be released, as I understand, during the Joint Information Center's, the briefing with the governor at 1 o'clock this afternoon. This is based on the 135 confirmed cases. So, from 2 days ago, right?
Right, yeah. So what Mayor Savar said is what they're still waiting on is the number of recoveries and the number of deaths. So when we get the number of recoveries...
And ethnicities?
And ethnicities. I don't know. She said that they might not
okay.
release that, yeah. And so obviously when you get the recoveries, they're going to do the math and half that. And but there's been some interesting talk about recoveries this morning, and I've heard Dr. Cabrera talk about it. That's something that I've put on our list for next week to really kind of dive into. How do you tell if someone's recovered? Are we doing any testing of these recovered patients, or is it just like 14 days? Okay, boom, you're out of here.
Yeah.
All right. So we're going to take a really short break, and we're coming back and jumping the show onto KUAM TV 11. It is containing COVID. Good morning, Guam.
We are open to serve you at Cars Plus Guam. Need a quick service?
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7...
Good day, everybody. I'm Sabrina Sauce-Mazzanati.
And I'm Chris Barnett. Join us bright and early weekday mornings on I-94 for KUAM News' containing COVID morning radio show.
Kantai man tunat nyagi toru ilugar para honra para gloria abiba islasen para honra para gloria abiba islasen para todo y tempo y paz para ita dan gini langit na bendición contra y peligro na fan sa fuham Deus protegis langom contra y peligro na fan sa fuham Deus protegis langom. There's a little island across the sea. Come on, my friend, take a trip with me to an island that I call home, where you can roll your windows down and feel the breeze. Stick your foot out, 5 biggies. Oh, I wouldn't change it for the world. 'Cause I love Guam, I love you. I've got love for all my Chetloos. I love girls.
808. Guam's favorite. It's the KUAM News Takeover of Containing COVID. We're KUAM FM and Agotnia, Guam, 808. Thank you so much to our KUAM TV 11 viewers. Like we say, we're trying to get this show out to as many people as we can in as many ways that we can. And we'll jump on the back half of the show, 8 to 10, go on to KUAM TV 11 because we know Tanchai is waking up, drinking her coffee with her. Hopefully you can get biscucha, there's no shortage. Also, we're streaming live on the KUAM News app and at KUAM.com. Docomo Channel 10, there's an audio stream. And good morning to you, to our KUAM News Facebook viewers. Please throw a comment. Of course, I know a lot of you guys are still digesting the release of the Village COVID-19 case count. And we'll talk about that, I'm pretty sure, coming up more. But 809, we want to go to the phones real quick because on the line, I'm very fortunate to kind of get him on here. He is the Assistant Secretary of Insular and International Affairs, Oceans, Great Lakes, and Coastal Program, Natural and Cultural Resource Hurricane Recovery for the U.S. Virgin Islands, Puerto Rico, CNMI, from the U.S. Department of the Interior. Let's welcome Mr. Doug Domenech onto the show. Good morning, Doug.
Good morning, Chris and Sabrina. Half a day.
Half a day.
Half a day. And so, I mean, you've been out here to our neck of the jungle a few times already, so no stranger to the island.
That's right. I've been out 6 or 7 times, but I'm sad that I'm not there now, and I wish I could travel out.
Well, even though you're not here, there are ways that you obviously can help out our island. And I wanted to follow up on this release that was sent out on the 13th regarding the $55 million in emergency relief funding that's available to the territories as a result of COVID. And so I understand there's like $12 million, I believe, that Guam can apply for in grant money. Can you provide any information on whether or not we've submitted the application and how long would it take for approval?
Well, let me again. I just want to say thanks for letting me be on the show today. You have a big reach, and so it's important to get the word out. And So I want to say hi to all my friends on the island, and that I'm thinking about you. Obviously, we're very concerned about, especially the list of COVID cases that you were reading in the last half hour. The very sobering release of numbers. We're tracking at about 135 total cases in Guam, and of course, our condolences go out to the 5 deceased individuals on Guam, and just a very sad, tragic thing that we're working with. And of course, including the one soldier that from the USS Roosevelt who passed away. And I just want to thank the governor again for her willingness, her office's willingness to be accommodating to that aircraft carrier, all our loyal sailors that are on that ship. And so we're all working hard to try to work through this issue. The president and the vice president, of course, are working very hard to do that. And as part of that, they have mobilized 42 different federal departments and agencies, including ours, to work through this funding that the Congress has passed and that the president has signed. They've actually signed 3 bills, that all of which have different packages, including the one you just asked about, that specifically in the CARES Act, there is a $55 million coronavirus fund that has been allocated through our office to the various insular areas. And you're exactly right that there was there is a $12 million fund that is what Guam will get as part of that. It's being allocated by population, and so they will get those funds. And specifically to answer your question, the governor has already done what is needed to get those funds, and we've already approved them. So basically, the way our funding works is it's based on drawing down certain expenses, and so then we reimburse as those expenses are drawn down. And so it's you're correct. It's $12 million, and that's going out. But that's really one of the smaller pots of money that the Congress has provided.
Okay. Can you take us through that?
To the extent that I can, I will certainly try.
Okay.
Again, there were 3 bills. The first one was called the Coronavirus Preparedness and Response Supplemental. That was $8 billion that primarily went to keep all the federal agencies running. Then there was the Families First Coronavirus Response Act. That was the money that went to support the free testing, expanded food assistance, increased Medicaid allotments for territories, and protections for healthcare workers. Then the third one is the one you hear about the most, what they call the CARES Act, which stands for Coronavirus Aid, Relief, and Economic Security Act. That was the $2 trillion giant bill that was passed. And there are many elements in that particular bill that include funds for the insular areas. It includes, obviously, the cash payments that 80 million people got those starting this week. The payments that went directly to folks who filed taxes.
Right.
It had the expanded unemployment assistance part was in there, including a new pandemic unemployment assistance program that expands the number of weeks that people can be on unemployment and additional funding in that. There was a fund specifically for hospitals and healthcare providers, $100 billion for hospitals, $950 million to support the territories. There was protections for healthcare workers, and that included money to add more of the PPE, personal protective equipment like what you're wearing right now, into the strategic national stockpile and to get it out to places that need it. CDC got $4.3 billion in that, and so other pots of money. There was the Payment Protection Program. That's the one you've heard about, that helped through the Small Business Administration to help small businesses stay alive. Basically, the funding, $350 billion, that provided zero cost loans if they kept their employees hired.
Right.
And so that's the one they're actually fighting about a little bit today in the Congress, trying to put more money into it because it's been so popular.
Right.
So there are many other sorts of, the big one that we've noticed is something called the Coronavirus Relief Fund, which will, from the Treasury Department, which will provide, again, it's divided up by population, and it's a $3 billion fund just for the territories. And, well, I should say just for the territories and D.C.
Right.
And divided up by population. By our calculation, Guam should get about $117 million just with that one fund. And so it's a lot of money that is being divided up, and I know money is not always, you've intimated about this already. A lot of places don't need money. They need.
Oh, we do though. Don't worry about that.
Well,
We're not one of those places.
People need machines. They need the test kits. They need the personal protective equipment.
The ventilators.
The ventilators, exactly. And those are the things that we're trying to track with CDC and FEMA. How can we get our hands on this stuff?
Right, and I think 30 ventilators recently arrived on Guam. The White House said that they were going to send them, and I believe there was an announcement just this week that we actually got the 30 ventilators. So that's some good news.
I think that's right. And then, of course, we have foreign partners that are helping. CNMI got those testing kits. I think it was 20,000 from South Korea. And the one thing that we're also learning, and it's amazing what people can do, there are new machines being invented that are quicker and it can give us results in a quicker way. And these are, it's just really amazing what we're coming up with, and hopefully people can get access to what they need to help alleviate all this, and so we can get back to normal business.
Doug, could we go back to those South Korean test kits? Are these the ones that are from Solgent?
I think that is correct. It's been a couple days since I looked at it, and I'm seeing so many reports nowadays that I'm having a hard time keeping up. And as long as we're talking about kits, very early on, so we're almost three and a half weeks ago, we funded a project through a group called PHOA, which is the Pacific Islands Health Officers Association, and through them we placed an order for 13,000 test kits to be divided up between the insular areas, and those have not quite been produced yet, but we'll get them out as soon as they're ready.
Those are from South Korea? Just these 13,000?
The 13, no. These are actually, believe it or not, are going to come from a plant in Europe.
Oh, wow.
I know. We didn't order them directly, so we're working through other groups to package the order. Actually, the way we're primarily interested in the U.S. affiliated Pacific Islands, the territories and the freely associated states. But our order was packaged with all of the other islands in the Pacific to make it a bigger order, because we thought that would help us get it fulfilled quicker.
Doug, what can you tell us about the chances of advancing any Section 30 funds earlier than September 30th? Is that any conversation have been happening with that between you and the governor, maybe?
We have not had that conversation yet, and sometimes these funds come in at the end of the fiscal year, so we don't actually have them at the beginning of the year. But if there was a way to get them out sooner, we would do that.
And just a question from a viewer here: the status of the war claims payments, Doug. What can you tell us about that?
Well, we're in fact, actually, in spite of all the work we're doing, focusing on coronavirus, my office, Insular Affairs Office, is doing all of its normal work. So we're putting out grant applications, taking in applications for coral reef and for endangered species and the wonderful brown tree snake that we're trying to eradicate. We're involved in all of that, as well as our regular funding for schools and that kind of thing. And we're very excited that the Guam War Claims Bill was finally finished in Congress, signed by the president, and we are working with Treasury to try to get them to release those funds as soon as possible. Of course, Guam fronted some of that money, your own money, to help pay the war victims, and we're trying to get you reimbursed as well.
All right, and so I guess would it be accurate to say that your office is working to fast-track war claims payments?
I'll accept that as a good way to say it.
You're cool with that then, Doug?
Yeah, if we could do it, we'll do it.
Okay, and then I guess you mentioned the most popular part of the CARES Act, which of course is the stimulus checks to individual taxpayers. I know that we're working hard on our end with Daphne Shimizu at Revan Tax, but is there any insight you can provide on the timeline of when we're going to be able to pay those checks out and when we get that pot of money?
I don't know specifically in Guam's case. I know that again, I mentioned the 80 million people were supposed to get them this week. I confess I got one. I didn't think I would, but I did. So I'm hoping that they're going to get out to Guam as soon as possible.
Mm-hmm. What about the PUA, the Pandemic Unemployment Assistance Program, and the Federal Pandemic Unemployment Compensation? The Department of Labor, local Department of Labor has kind of been held hostage with issues with the Federal Department of Labor, and he mentioned that it's actually happening across the country. But do you have any idea how long it would take to kind of resolve some of these issues so that those payments can start going out?
Can you tell me a little more about the problem that Guam is having?
Well, it's mainly, I think he's waiting for...
It's a lot of back and forth between our local DOL and the federal side. Doug, of course, because they just stood this program up and then Guam didn't have the unemployment insurance. And so we're hearing there's some $900 million that's going to be paid out to displaced, furloughed, and laid off workers.
Right. He has to get that budget approved, submit this supplemental budget, which then has to be approved by USDOL, because he's looking at least 36 to 38,000 displaced workers here on Guam as a result of COVID.
Yeah, the need is definitely there. I will definitely look into this tomorrow so that I can figure out if my office can help. But we knew there was going to be a problem because of the unemployment system in Guam. But my understanding is everyone qualifies. And in fact, all workers, including compact migrants who are there working, would qualify for the same funds. And the whole goal is to keep everybody afloat until we can get through this, hopefully in a month or two. I don't know how long it's going to take.
Right. Okay. That being said, Doug, I know you know some pretty influential people there on the Hill. Is there anything happening with maybe another stimulus package in the event that this COVID-19 crisis and response goes longer than we anticipate?
Well, I do think, and we are hearing rumors that there will be a fourth and maybe even a fifth bill stimulus. We have been, not sure I'm supposed to say this, but I will. We have been asked for ideas. For instance, what would be good infrastructure things that we could try to pay for now, since the federal government's probably going to pay for it eventually. But what are some ideas of infrastructure, bridges, roads, that type of thing that the government could put on a list and possibly pay? And there are several things that we put on the list for Guam that we thought would work. Of course, we're just one small voice in the discussion, and your congressman, of course, will be very vocal, I'm sure, on what should be in a package like that as well.
So what kind of conversations have you been having with our congressman?
Oh, well, we don't talk all the time, but the conversations. He was very active, of course, in the discussion about the War Claims Act, and we worked together with the White House to try to get that solved. And he was very involved in pushing the legislation through the Congress side. We were working with the White House to make sure they felt good about it, and that we could work. Tony Babauta and the governor worked very hard to get the approval from Treasury for the program you all set up to start getting the money out to some of these deserving people, especially because they are so elderly. And so it's all good. We have good relationships.
Oh, good, Doug. Man, it's been so great to hear about you. Could you tell us a little bit more about that? You mentioned that there was some hospital money in one of these pots that you had talked about. How do we get some of that?
Well, so again, a lot of these pots are not coming through my office, so I'm not up on the complete details of each one, but there is a provision that is called Helping Hospitals and Healthcare Providers, and that's the one that I think is mostly going to the CDC to help with hospitals, $100 billion fund, and 950 of that is supposed to go to the territories. Of course, that includes Puerto Rico, which always takes a giant chunk out of the any money that goes because they're so big. And also the money is going to go to public health activities, so public health offices, that kind of thing. And we don't have the details on how they're getting that money out, but that's as much as I know.
Well, we really appreciate you taking time to talk with us. Is there anything you wanted to, any final comments?
Maybe a message out to the people, or?
Well, I know the people in Guam feel like they're very far away from the States and even further away from Washington, D.C., but we think about you often, and every time I hear it's where America's Day begins, I think about you. And it's a beautiful place. I can't wait to get back and have some good food and go snorkeling. Last time I was there, I went snorkeling, and it was great. I went out with the National Park Service. Of course, as you know, we're part of the Department of the Interior.
Right.
So the National Park there is part of the Department of the Interior. The folks that are with the U.S. Geological Survey work there. They're part of Interior and the Fish and Wildlife Service. So it's more than just me thinking about Guam.
Well, Doug, thank you so much. And I'm doing my part because I know when you're saying that a lot of these pots are based on population, I'm encouraging everyone out here to continue making more Guam babies so that we could get a bigger chunk of that pot.
I would just say I look forward to being on the show again when I can actually see what your faces look like.
Nice. Well, you're not missing much on my part. Thank you, Doug.
Okay.
Thanks, Doug.
Okay, wash your hands.
Thank you.
Okay, God bless. All right, there you go.
What a great guy.
Hey, that's Doug Dominich from the United States Department of the Interior.
Hopefully next time he's on island, we get a heads up because we usually don't.
Yeah, maybe go snorkeling.
Yeah.
8:29. Hey, we'll take a little quick break, and we're going to come back and do a deep dive into the day's COVID-19 news with Sabrina Salas, Matt Tanani. Good morning on you.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Good day, everyone, and hello mga kababayan. Nestor Lecanto here from KUAM News. Just wanted to remind you all that we are in the midst of this battle together, this war against the coronavirus, COVID-19. And just wanted to remind you, one of the best things that we can do to fight this is to wash our hands. I saw something on TV, and you need to do this for at least 20 seconds. You can maybe sing Row, Row, Row Your Boat or Happy Birthday a couple of times, but make sure you get everything. Get the top of your palm, your hands, the bottom, your thumbs, in between your fingers, and you can even use just regular soap and water. But just wanted to remind you that we're all in this together. We're going to get through this. And finally, stay home. That's very, very important.
Hafade Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Howdy, everybody. I'm Sabrina Salsamatanani.
And I'm Chris Barnett. Join us bright and early weekday mornings on I-94 for KUAM News' Containing COVID morning radio show. It's also being broadcast live on our KUAM News Facebook page.
You know, we don't want to be doing this forever, and you probably don't even want to listen to us forever. But that's why it's so important that you practice social distancing. You know the drill. Wash your hands.
And stay home! Just stay home!
Stay home!
We're working hard to keep you safe. Wash your hands. Stay home.
Howdy, this is Ryan Clowers from Crescent Fitness. This is a quick public service announcement. We want to remind everyone, please just stay home. Go kick back in your pajamas, like we're doing. Go spend time with your kids. Go do the things that maybe you've been kind of just forgetting for a while. Go get a workout in. But the big thing is, please stay at home. For the sake of your kids, your family, and your future generations, please stay home. Evan, what about you?
Stay your butt home.
Off the day.
I play a little bit for my Palau crowd, Elway, Akeda with, I don't know if it's Keimer or Kimmer. I know it's his boy's name though. It's a good song, 8:35.
We'll ask Carlito when he gets in.
There you go. Good morning, Guam. Hey, we got Tomas Manglotnia. He is our man in the CNMI with the latest there. That's coming up. But first, a deep dive into the day's COVID-19 news from the KUAM News team. Sabrina Salas-Matanani, good morning.
Off it, everybody. Good morning. Here's the latest from the Joint Information Center, released at 9:40 p.m. last night. Public Health tested only 11 individuals for COVID-19 on Thursday. 0 tested positive. There has been no results released from the Guam Memorial Hospital that now has testing capability. So the number remains at 135 confirmed COVID-19 cases on Guam, with 5 deaths and 86 recoveries. $11 million worth of checks should be going out today. The governors last week announced that they were advancing $11 million out of the $134.8 million approved by the IRS in federal economic impact statements. DRT is issuing the advance payments to tax filers with adjusted gross incomes of $10,000 or less in tax year 2018. The local business community will need to keep a close eye on Congress in the coming days. Many Guam small businesses have already received federal stimulus funding to keep them and their employees afloat during the virus crisis. Our Nestor Lecanto asked the governor about this during her press conference yesterday, as well as her plans for economic recovery.
My question for the governor, and we just got a release from the SBA, and they issued a statement attributed to Treasury Secretary Stephen Mnuchin and small SBA Administrator Carranza. And if you'll indulge me, let me just read 2 sentences here. By law, the SBA will not be able to issue new loan approvals once the programs experience a lapse in appropriations. We urge Congress to appropriate additional funds for the Paycheck Protection Program, a critical and overwhelming bipartisan program, at which point we will once again be able to process loan applications, issue loan numbers, and protect millions more paychecks. As you know, the PPP and the EIDL have been relied on heavily by our local small businesses. I'm wondering if you had a comment on that, if in fact the Congress does not appropriate any more money.
Right now, I know that we have, I think, about 53 million already in loans for the PP protection program, and I know that the SBA also has been doing the EIDL loans. And so, like I said, right now we have in the coffers 53 million. I don't really know if that's all been distributed, Nestor, but certainly if the funding source is not there, then we can't continue on with the program, and we'll just have to work with Congress to provide more funding availability and funding sources for the program. But we have 53 million already, and I think that equates. I'm trying to find my my information on that in terms of how much businesses that is. So let me see. Okay, so we do have 53.6 million for the SBA, the PPP program, and nationwide there's like $247 billion that's already been approved. So for our loans for PPP, we have approved 238 businesses. I think that is a a big amount of loans that have been approved. I don't know if that is. I don't know what's pending. I don't know how many, but we certainly will be in the line for those loans to be funded again.
Great. Thank you, Governor. Second question is, I know you probably at this point, based on your previous statements, believe it's a little might be a little too early, but have you at least thought about bringing in some economic advisors and starting to make plans to restore our economy once we do finally emerge from this coronavirus crisis?
Sure. Yes, I have. Actually, our economy cannot be restored, Nestor, unless, of course, we have the health and safety of our community. And so that has always been our focus. But the concern about the health of the economy has always been along with that focus. I am establishing a panel of individuals, representatives from the government, the private sector, economists, also along with our medical advisor. and that's going to be my recovery panel advisors. And at those meetings, we will be discussing strategies and the methods and how we will move forward with the recovery period. It would heavily capacity is. It would also look at how good our contact tracing and surveillance will be, and our capacity and expansion of testing. Those are some of the key indicators that I would have to be looking at in order to feel like and trigger recovery into the recovery phase.
The Chamber of Commerce, in the meantime, has been informed by the SBA that the monetary threshold for funding the PPP, the Paycheck Protection Program, and the EIDL, the Economic Injury Disaster Loan Program, has been met. The SBA will not be able to issue loan approvals once the programs have a lapse in appropriations. The Chamber is saying, we hope that Congress will appropriate additional funding to support both these very important programs that are essential for our small businesses. The Office of the Attorney General is following a crime level spectrum when prosecuting offenders during the pandemic, with nonviolent offenders being booked and released and violent offenders booked and confined. Based on this spectrum, earlier this week, the Office of the Attorney General released two 19-year-old men, BK Petrus and Rafiki Kinam, from jail after being arrested for terrorizing residents at the Harmon Breeze Apartments. Adriana Cotero asked the governor about this issue yesterday.
As I'm sure you know, Governor, the Office of the Attorney General has implemented a crime spectrum to follow for prosecution during the pandemic. And this being non-violent offenders being booked and released, and at the other end, violent offenders being booked and confined. There was a recent incident with two offenders being released and falling in the middle of the spectrum. However, they had made death threats to a family. They were charged with terrorizing and criminal mischief. There was property damage and home invasion.
Right.
Yet they were released, and now victims, they're feeling like they're left in fear and feeling victimized by the criminal justice system.
Yes.
So what are your thoughts on this issue at hand?
My thoughts were this. I was not aware of this until earlier yesterday. So I asked my legal counsel to work with the courts. The whole focus on this, Ariana, is so that we can also make sure that our DOC population is not increased in any of the exposure possibilities. I am concerned that these two arrestees, it may not be violent, but I was not very happy that they were released. And we are working closely with the courts also to look at what are some of the things that we could put in to again protect the DOC from exposure. And some of that would be, one of that I am thinking about is to test these people before they are confined. So, and also to make sure that at the DOC there is a designated building that's solely for possible COVID PUIs and for isolation and quarantine. So we need to institute that. And I totally understand the feelings of our community, of their insecurity, and this crime to me is not a minor crime. To me, I see it as a much more violent crime. And we are working with the courts to have a much better clarity on it.
Following statement in response to the governor's quote, it was admittedly surprising that she was not happy given that our approach was taken in line with the directives of her office, in line with and the Public Health Authority. However, now that they are prepared for returning to standard confinement practices and are working with the court to manage the prison, our office will move forward in support of this new direction. The governor will not be getting her curfew authority. Senator Amanda Shelton's bill that would have authorized the governor to impose a limited curfew for all was resoundingly rejected by a 12-3 vote. Only Shelton, Speaker Tina Mooney Barnes, and Vice Speaker Talina Nelson voted in favor of the measure. The governor was seeking to put more teeth into her order for people to stay home, but many in the public balked at the idea, citing an infringement on civil liberties. Senators did pass 6 other bills unanimously. They include expedited procurement of COVID-19 medical supplies, an exemption from the 900 instructional hours requirement for public schools, an exemption for the service learning requirement for graduating seniors, and specifying who gets hazard pay in the COVID-19 pandemic. An update on the USS Theodore Roosevelt. As of today, 90% or 94% of crew members have been tested for COVID-19, with 615 positive and 3,958 negative results. 4,046 sailors have moved ashore. 5 sailors assigned to the USS Theodore Roosevelt are in U.S. Naval Hospital Guam being treated for COVID-19 symptoms. One of those sailors is in the intensive care unit for increased observation due to shortness of breath. As reported, 1 sailor passed away earlier this week. In the meantime, NBC News is reporting that Secretary of Defense Mark Esper indicated that it's possible Navy Captain Brett Crozier, who was relieved of his command of the USS Theodore Roosevelt after raising concerns about a coronavirus outbreak, could be reinstated. In national headlines, the national death toll from the coronavirus has risen sharply, now up to around 31,000. That's partly because New York City is now counting deaths of people who had COVID symptoms but died before they could be tested. Elise Preston reports from New York City, the epicenter of the U.S. outbreak.
This nursing home in New Jersey reportedly put 17 bodies in a morgue only big enough for 4. A CBS News investigation reveals the coronavirus has been especially deadly for America's most vulnerable populations living in nursing homes.
People who work there are the most underpaid. I used to call the ugly stepsisters of the healthcare industry because we don't pay enough attention. We don't pay the nurses' aides enough.
In Sioux Falls, South Dakota, the number of confirmed cases has grown to at least 644. The nation's biggest hotspot originated at the Smithfield Foods pork processing plant. Today, the CDC will tour the now closed plant in hopes of reopening it and minimizing the impact on the nation's food supply. Here in New York State, a new order goes into effect tomorrow. Everyone must have their faces covered when they can't maintain social distancing. That includes walking on a public street, using public transportation, or grocery shopping.
If they want everybody to wear a mask, I see nothing wrong with it.
The city of Los Angeles also has a mask mandate. The mayor now says large gatherings like sporting events and concerts will likely be canceled until 2021. And while restrictions are getting stricter for some people, others are pushing back. Protesters filled the streets in Michigan and Kentucky on Wednesday, and the mayor of Las Vegas is demanding an end to Nevada's lockdown, where the death toll is less than half of 1% of the state's population.
It makes no sense. For heaven's sakes, for being closed is killing us already.
But health experts say more widespread testing is needed before things can get back to normal. According to the COVID Tracking Project, less than 1% of the U.S. population has been tested. And the Association of American Medical Colleges sent a letter to the White House task force calling for more federal involvement. Elise Preston, CBS News, New York.
And finally, apparently I wasn't ready. Payless and Calvo Select Care donated $32,000 to the Guam Medical Association, which in turn used $16,000 to purchase 500 reusable PPEs and delivered to GMH. Additionally, $3,000 was used to purchase almost 500 bottles of hand sanitizers, and again going to the Guam Memorial Hospital. IT&E donated 30 mobile hotspot devices with 4G LTE data service to the University of Guam, so students who do not have internet access can complete online coursework with high-speed connectivity. And finally, Ambrose Inc., Anheuser-Busch, and Kimberly-Clark donated 100 pairs of safety goggles and 149 cases of various level coverall garments to the front line. Sales manager Frank Shimazu Jr. stating, from the health professionals to the teams that have to enter contaminated areas, we want to help keep these heroes safe. And that's it for news.
All right. We're going to do that breakdown again by village?
Yeah, that's what I was trying to pull up.
Okay. So we have, again, let me preface this. We have obtained and had confirmed the list of COVID positive patients per village. We spoke with several mayors. What they're waiting on is the number of recoveries per village, and I think also the number of deaths per village.
Right. They're waiting for more specific information, and I
Right.
believe this dashboard of information is going to be presented during the briefing this afternoon.
I think so. And then that's going to be, what we're told, is going to be up and available for the public to view.
Right.
Okay.
Okay, so in the village of Igania, 0. Sinahanya, 4. Ora Chalampago, 5 confirmed cases. Jotnya, 5. In the village of Talafofo, 7 confirmed cases. In Arahan, 2. Umatic, 0. Agate, 3. Santa Rita, 1. Petey, 1. Agani Heights, 5. MTM, 1. In the central village of Barragata, 13. Mingilao, 14. Jigo, 13. In the village of Dededo, 42. Tamuning, 15. Asan Maina, 0. And Maritzo, 2. Now that equates to 133, but you factor in the 2 homeless confirmed cases. That's a total of 135 confirmed cases of COVID-19 on Guam.
And again, this information has been confirmed by several mayors this morning. Of course, Mayor Melissa Zavaris, who is the president of the Mayor's Council of Guam, told us that this information was presented to mayors after they've made repeated requests for more transparency from the governor's office and the COVID-19 response team. And I think it's good for all of us that we're now getting that transparency. It's tomorrow standard time, I guess. 8:52. Now we go to our man in the CNMI, Tomas Manglotnia. Good morning, Tomas.
Good morning.
Good morning.
I guess we'll just let you do your report, and then I wanted to ask you a couple questions about your interview with Kalili. So again, with the latest on the situation, COVID-19 and the CNMI, Tomas Manglotnia. Good morning, Tomas.
Good morning. So the latest on containing COVID in the CNMI, an update as we head into the weekend. As of April 17, the CNMI has 13 confirmed cases of COVID-19, 2 deaths, and 9 recoveries. And first, starting with the public school system's Grab and Go meal program, that started again on April 16. They resumed all Grab and Go meal programs for Saipan, Tinian, and Rhoda. Free meals for all children of the CNMI, ages 18 and below, Monday to Friday, 9:30 a.m. to 11:30 a.m., 1 meal per child while supplies last. Also, with the local CNMI government getting a clearer picture of the numbers in the government, approximately 6,000 employees represent the entire CNMI government. The governor's office yesterday telling us that terminated and furloughed numbers are approximately 50% of this figure, so it's an estimated 3,000 who are affected. And more news from U.S. Congressman from the NMI's Kalili office. Female leadership shared the most recent worst-case projections with Congressman Kalili last night for the NMI. According to the Johns Hopkins University model, it shows a possible peak of 6,000 cases in the Marianas by the end of May to early June. He said that we can change it if each of us do our part. Again, Bree and Chris, we spoke with Congressman yesterday. It's a very revealing and telling interview. You can watch that full interview now streaming on KUM News' Facebook and YouTube page. We talked about the CARES Act, government cuts, the public school system, and retirees cuts. And he tells us that he's presuming to run for re-election in this next cycle.
Yeah, that was a good interview there, Tomas. A lot of insight into Congressman Kalili and the efforts, of course, to contain and battle the coronavirus, both on Guam and in the CNMI.
Definitely. That was 38 minutes worth of conversation. He talked a little bit about his communication with the local COVID-19 task force here, saying that basically, he's only received written communication, and he's working with Michael Nicholas, the congressman, of course, there from Guam, on more help on the way for the territories.
Mm-hmm. Has there been any word on when there's going to be any sort of a media briefing with the governor?
Every time we've asked the governor's office, we're told, wait and see. I think this week, Bree, if I'm correct, it's been 3 weeks since the last briefing, so we haven't had that chance.
Okay. I mean, I noticed he's really stepped up on Facebook doing his reports from different places, so I just didn't know if he was going to be actually addressing the media instead of just, putting out this one-sided information.
That's the trend, though, Bree. I guess if you go around the nation, a lot of
Well, that's one way to control the message, right?
Yeah, definitely. And what's your take on that, Tomas? Is that something that the people in the CNMI talk about? That the governor there is not willing to engage with the media?
I have to say, though, that there are one-on-one interviews that are being offered. I got to give credit to the hospital CEO, Esther Muñoz. She's agreed to practically weekly, if not, several interviews in 1 week. In fact, just kind of on the same topic, I reached out to her to ask to talk to a doctor with regards to the South Korean test kits. We know that a pathologist from South Korea is training members of the CNMI hospital on how to use that. And so we hope to get that out next week. But with regards to the governor himself, we haven't had that press conference, since about 3 weeks now. And folks just want to hear the daily updates. And, as Bria alluded to, those, edited, highly produced, elaborate videos on Facebook aren't really cutting it for people in terms of getting the information. There might be, some nice background music, but we really just want the background info. So that's what I'm hearing here.
I like that, Tomas. So, but when if you're going to ask the governor stuff, is there stuff that you can ask, other people? I mean, are you not getting any information because we can't interview the governor? How are you working around that?
We're just, I talked to the mayor of Tinian, talking with the hospital as well. And I think that, a lot of the other officials are willing to talk directly. I think, though, that, we've been giving points of contact, and we're just hoping that, the point of contact can ultimately be, the governor himself, who can share information directly on what he's working on.
Okay. Well, good luck, and hopefully, we could get this interview with him.
Yeah, I've got to give it to, I've got to also give it to Adriana Cotero with the KUM news team because, she was a reporter here before, and she's continuing to ask. She's also helping with the coverage in the CNMI when she can. And so, the request has been put in. I think Chris, joked last week, Adriana's been asking for a year. So we're hoping if that happens, I hope she gets that interview when she can.
All right.
All right, thanks, Tomas.
Yeah, so what are you working on for today, Tomas? What kind of info are you trying to track down for the people in the Marianas?
Yeah, and so as I was sharing with the news team, we're following up with the CNMI government on the exact date for those 40,000 more test kits. I know we've reported that it's going to be in the CNMI by the end of the week, but we're going to see when that actually arrives, get more information on that. We also want to know about the cost of the kits. I know this was something that other media are also looking into. How much are exactly these kits? We know that the CNMI governor's office told us that these are FEMA reimbursable funds, so local funds were used to purchase them. And like I said, I'm working on getting more in-depth interviews. I want to definitely talk to a medical professional who's actually using these kits and not just talking about them or reading about them. So I'm in talks with the hospital to get a medical professional on island who's going to be actually using the kits or training other folks on how to use that.
Tomas, what do you make, and have you seen any comments by the governor there in the NMI in response to what our governor here on Guam had said when asked about the South Korean test kits? I mean, she was pretty triggered, and I think that you can kind of tell that this is just a no, hard no, and I believe she said, I don't know if it was yesterday or the day before, that it's a dead issue to her.
I was sharing, with, as we reported through the week, the officials in the NMI say it's a highly accurate test, and they're using it again for surveillance and containment through a community-based testing. And I think where it might not add up for folks is that, we've got countries, cities, Canada is putting it on its official list. And so I think there's just, if not, just a healthy amount of skepticism as to the resistance on it. I think the phrasing we're hearing is US FDA approved, and I think that was especially outlined in yesterday's show about, how it can be used and not used.
Well, I mean, it's interesting that they're saying they don't want to use these tests because they're not FDA approved when the tests we're currently using are also not FDA approved.
They're
EUA,
yeah. We interviewed Esther earlier, and in that full interview, I posed that question to her about, the fear for false negatives. That interview is on, that full interview is on KUAM, and we did that interview on April 14, I believe, and I pressed on that. I said, people are concerned about false negatives, and she had no hesitation in saying that of course false negatives are always a concern, but they're going to be validated by the US FDA approved ones.
Right, and these were for surveillance purposes.
Right.
Yeah, and again, I don't think it's lost on us that we saw that New York Times report saying that now the U.S. is going to receive 1.5 million of these tests from Solgen, that same company. And, I don't know, maybe trying to get someone from Solgen to speak with us, but, we just got to get more clarity on this.
Yeah, well, did you hear what the Assistant Secretary of the Interior, Doug Domenech, said? He had actually referenced those test kits and, talked about them being delivered to the NMI, and I thought that was pretty interesting.
Yeah, it was, and it's people tell us to turn to the doctors and the experts, and it seems like we're also along that same spectrum of not really knowing when we talk to doctors and experts. So, I hope that's why I hope to get that doctor who's actually using the kit to clarify even further, even if we've got that long interview clarifying the use of it in the CNMI with Esther Williams.
Right.
And I got to rewatch Dr. Hoa Wynn's interview because he made it sound like there were these test kits from South Korea that came in, they confiscated them, a wholesale company brought them in, they confiscated them, and now they're going to use them to do studies?
Yeah, studies. And he mentioned something with the University of Guam. That was some new information. We get a lot of new information here on the show. That's why it's important for our
and I
our
believe
viewers and our
somebody from
listeners.
Solgent is on Guam. I believe that's what he said. So.
And Tommaso, when I asked you about with the reaction with the governor, or maybe if you can ask the press secretary, is that our governor here had basically said when asked about using these South Korean test kits, I think her response was that she didn't want to risk anything and risk the people of Guam by using these tests. And I mean, to me, that was kind of like alarming because you got 60,000 of them or whatever in Saipan, and the people of Saipan are going to use them, and it kind of CNMI, and it kind of I don't know, if I was in the CNMI and I heard the governor of Guam say this, I might have a little anxiety about, well, does she know something we don't, or because it just really seems like there's something else going on here. I don't know.
And I think also, the perspective from the NMI too is that we're getting, as last reported, 5 tests a day on Guam in addition to those that are sent off island. So the urgency also, is there in a very different way as well.
Right, and we just tested 12 people yesterday. So there's a lot of talk about how much we need to do mass testing and how we need to test more people. But sadly, that's not happening.
And it's primarily, or at least Dr. Hoa was saying, that it's because we're short on test kits and on supplies. But you don't hear that from the government telling you that.
Yeah, I mean, maybe if we had more than 2 questions, we might be able to ask something like that. Okay, Tomas.
Thank you.
Hey, appreciate it, brother.
Thank you so much. Have a great day.
Have a great weekend and wash your hands, okay?
Thank you. You too, Chris.
Okay. There's Tomas Maglonia, Jason.
Well, what was interesting, I didn't want to interject because I was, first of all, what an amazing kid Tomas Manglonia has always been. We had the pleasure of being able to have him as our intern. He is breaking the big stories now. I mean, he's in Stanford. He's enrolled in Stanford. Obviously, he's not going to school. I mean, he's taking like distance stuff. But I mean, he is going to go back to Palo Alto when school resumes and everything like that with a chocked full resume. So I mean, he's doing great work. But I was doing the tech support when he had that his video call interview with Gregorio Kilili Sablan yesterday. And Congressman Sablan afterwards, he was very gentlemanly. He even said afterwards, he's like, I think it's great that you guys are doing this, and I'm very happy to share what's going on in the Marianas. But, how often do you guys dialogue, with your own congressman? And I was like, well, we hit his Facebook page every once in a while, and that's probably pretty much where it starts and ends.
But Jay, was there a commitment made by Congressman Kilili Sablan to maybe try and finagle and get Congressman San Nicolas to engage with KUAM? Was there anything said on that?
I actually asked him, and I said, if you happen to run him by him in the hall and say, hey, Mike, your hometown news station's like really trying to get you on some stuff because they want to get the word out there, and he goes, I'll try and pass the word around. But he goes, he said, I'm very, very open, and he's like, oh, Tommy, because he's known him since he was a kid, right? But he goes, how often do you guys actually have this with your own congressional delegate? And I was like, not today. It's not that we haven't asked.
Yeah. Okay. All right. Thanks, Jay. Jason Solis, of course. We'll get him to read off some comments coming up in a little bit. We're KUAM FM in Agotnia, Guam. A lot of people are asking about stimulus checks and filing. I've got a lot of questions about filing taxes, especially for those who have not yet filed and are trying to get these federal stimulus checks. And so with that being said, we're going to get the Revenue Tax Director, Daphne Shimizu, onto the show in just a little bit. It's 9:05. We'll take a short break again. It's the KUAM News takeover of Guam's favorite I-94 containing COVID. Good morning.
GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Howdy everyone, and hello mga kababayan. Nestor Lecanto here from KUAM News. Just wanted to remind you all that we are in the midst of this battle together, this war against the coronavirus, COVID-19. And just wanted to remind you, one of the best things that we can do to fight this is to wash our hands. I saw something on TV, and you need to do this for at least 20 seconds. You can maybe sing Row, Row, Row Your Boat or Happy Birthday a couple of times, but make sure you get everything. Get the top of your palm, your hands, the bottom, your thumbs, in between your fingers, and you can even use just regular soap and water. But just wanted to remind you that we're all in this together. We're going to get through this. And finally, stay home. That's very, very important.
Hafade Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Oh, Tumanbe. Actually, just stay home. The Matt LaGuardia and his girl star, Chamorro Pride, getting you ready for Stay Home Live Local Fridays. That's this Friday again. This the second one?
Yeah, no, this is the third
one.
one.
Wow.
Tonight, 6:30, KUAM TV 8. We've got a great show. We have Joe Guam, who's performing for us.
Andrew Gubatautau.
Chris Boomer.
Baba B.
Baba B.
Yeah, it's a jam-packed show. You know, but somebody was asking me, why did you guys get Baba B on there? He's not, he's an honorary already, you know what I mean? 912, highly anticipated call here about to go down with the Reventax director, Daphne Shimizu. Thanks for joining us this morning, Daphne.
Thanks. Hi, Sabrina.
Hi. Good
Hi,
morning. I hear you. We're all hoping you have some good news.
Well, I think one of the biggest questions is that I've been asked is, have checks gone out? You know what? I'm getting a little feedback. I'm not sure if you're hearing that.
You sound good on our end, Daph.
Okay, great. Okay, so one of the questions that's been asked is, are checks in the mail? And so, yes, Reventax did print several thousands of checks this past week, and Treasurer of Guam received those yesterday, and my understanding is that there are payments that are in the mail. I don't have the final information on the final numbers right now. We will release that information, but again, as Governor did mention, we would be sending out checks this week, and there are payments that are going out. If they've not already gone out, they're going out today for sure.
Okay, and
that's great news.
So, but we're still looking at a total of $11 million that's going to be paid out in local funds.
That's what I understand.
Okay.
Yes.
What about the latest from the IRS on the remaining money?
Sure.
Have you heard anything from them?
Well, and thank you so much for just being patient with me this week. And it's been very intense in terms of discussions with them. Like some nights I'm on the phone with them 11 o'clock, midnight, and then I'm up again at 5 in the morning just discussing with them, because trying to make sure that, I try to catch them at the beginning and end of their days. So, making sure that we're moving forward with it. We don't have, outside of the fact that we're continuing to discuss the implementation plan. We're still not finalized, but, we're continuing to do that. And at the same time, there's a lot of background work that still had to happen. And in fact, part of, what we had to do to make sure that we can cut these checks in this past week or this week is making sure that we set up our system so that it was ready. So simultaneously, while we're discussing these things with the IRS and also working to get clarification on various items that and how the CARES Act applies to our U.S. Guam residents, we were also on the background and even through Easter working with our IT team, with our IT vendors, just to make sure that we could stand up our system and that our system is ready. And I'm very proud to say that, our team has worked to make sure that it's ready. And I believe that, for the most part, once we do get the advanced payments and our final implementation plan, the money's coming, the cover over monies from the U.S. Treasury, and we get the implementation finalized, that, we'll be able to begin to do our mass payments out to our people. So that's great news to me. And there's a lot of work that goes into all of this, and those are the things that I try to stay involved at all levels. So I work with the IT team, I'm working with our tax administration team, and I'm closely just monitoring as well the people who are actively working. And if you don't mind, if I just can give a shout out to some of my team members who have been working and kind of supervising, to Nora and Norma Jean and Rose and just Craig and everybody who has been coming in and making sure that we're safe. We have our compliance officer who's going around and making sure everybody's practicing social distancing, making sure that our people, are safe. We have people in our administration group like Marianne and Jason who have been there every day checking the mail. And so, I'm very fortunate. We have a really dedicated team. As I mentioned to Chris a few days ago when I had the opportunity to just talk with him a little bit, this is very personal to me. And this idea of taking care of our people is very important and personal to me, but also to our team. When we had to activate the team after the CARES Act was passed, of course, given the whole situation with, of course, we're trying to stay congruent with stay at home, but we're having to be activated so that we can make sure that these background functions that need to happen so people can be paid these economic impact payments. You know, those things, you know, we have these very committed people who, when I called, they're like, don't worry, Daphne, we're going to come in. We're going to come in and we're going to do our best. We've always, you know, people who have been there for 20, 30 years. And so I'm very proud of our team, and I want to say thank you to them. And I'll also say thank you to our community for being patient with us. There's a lot that's going into making sure this happens, but I promise you that we're doing everything possible to make sure that that these payments get out. And as soon as we get the implementation plan finalized, and again, I've been meeting and talking with IRS daily, sometimes more than once, sometimes even like 2 or 3 times a day, you know, in effort to get this going for our community. I promise you, you know, we are doing everything possible to make sure that this happens. You know, we recognize the importance to our people. You know, I'm not someone that comes from a lot of money. You know, I know what it's like to, and I went to Mauricio Elementary School. You know, I know what it's like to come from a community that's very.
So did I, Daphne. So did I.
We're very, you know, I'm a country girl, so I know what it's like to you know, I guess to be in need, and I have family members who are in need, and so I really, you know, see the needs of our people. Right, and so, you know, of course, in order for us to be able to do this, yes, first of all, yes, it's based on 2018 filings, and so in order for us to be able to even make payments, we had to look at a universe of returns that was basically complete, right? We know that there's a few things that happened when we came into 2019. One, because of the coronavirus, the IRS extended the deadline for filing and payment for individual income tax returns for 2019 to July 15th. So that may have caused some people initially to not file 2019, right? Right away. So we had to look at a universe of returns that was, you know, basically complete, which was 2018, and so we utilized the 2018 as the basis for this. But you know, not to say that going forward, of course, you know, just again, the CARES Act does allow the use of 2018 and 2019. We're utilizing 2018 as the primary basis only because we recognize that that's where we're going to be able to make the most impact to our people. And the CARES Act also does say that, and it was Congress's intent and our president's intent to make sure that we get these payments out as rapidly as possible. And it's our intent to make sure that our people are taken care of as quickly as possible. So we utilize that population.
Daph, what about people who need to file the 2019 taxes? Can you just go through what options are available to them in terms of getting the docs and then, you know, getting them over to you guys?
Sure. So for 2019 returns, there is actually the opportunity for people to file online if they are able to. The online filing option is available for individuals or for people who don't have dependents and who only have W-2 or 1099 income. So, you know, you can get onto myguamtax.com. You can register. I've actually done that myself, so I could test the system. It works. So you could file online. And if you don't fall in the category where you can file online, then you can, you know, get your return prepared. You could drop it at the Dropbox, which is at our Barragata office. We have a Dropbox. You can mail it to us. You know, you can mail it to us using the U.S. Postal Service, or you can, if there's a payment due with it, you can actually go to the Treasurer of Guam cashier at the ITC building because they've been open this whole time. So those are the 4 ways. You can either do it online if you fall into that certain category of people that can file online. You can, you know, again, go to our Dropbox and drop your payment and your return. You can go to or mail it to us using the Postal Service, or you can go to the Treasurer of Guam if there's a payment due. So those are the mechanisms for doing that.
Daph, just to go back to the individual payments, are you guys using tax year 2018 and 2019 filings to pay out those $1,200 and $2,400 payments?
Right. I mean, you know, we had, again, what we needed to do was we needed to look at a population that was primarily like fully complete, right? So we looked at 2018, but again, if somebody hasn't filed a 2018 return, but they filed a 2019 return, then we're going to look at 2019, and that's how that will work. Okay. And again, you know, so the way that you know, there has to be some understanding, I guess, in terms of the infrastructure of our tax administration agency here on Guam versus the tax administration or versus the IRS. You know, the IRS has a 80% or more online filing rate.
Right.
We have about a 3% or less
Wait,
filing rate.
say that again. 3%.
We probably are at like a 3% or less, at least before this situation. That's what I understand.
Right.
So in terms of, you know, online filings, you know, of course, for the IRS, if they have 80% or more, this is what I understand is 80% or more, that, you know, for them, you know, they don't have a lot of manual processing that's involved with regards to what they need to pay out. For us, we do have. And so, you know, there are certain limitations because of our structure. And so we recognized, again, you know, if we needed to make out payments as soon as possible to our people, that we had to look at a year that was complete so that we can impact our people the most and the most quickly. And so that's what we did. But there is a true-up mechanism for this, right? So, and we still have to identify and provide official guidance on that, but there is a true-up mechanism. So for individuals, say, you know, regardless of the year, say 2019 or 2018 is used, there's a mechanism for truing up. The reality is this is actually an advance credit, meaning that this is a credit that is paid out for a 2020 tax year, but the 2020 tax year hasn't been completed yet. So in the perfect world, we would use your 2020 tax information in order to be able to determine your eligibility. But because obviously we're not in a perfect world and we need to make sure the money gets out, you're basing eligibility on another year. So we have to point to another year. And that's really, you know, kind of how this is all working. But again, even if people, for example, say I'm somebody who made, you know, I'm single and instead of getting $1,200, I got $1,100. When I, for example, this is an example, file my 2020 tax return, if my income level is such that I should have actually received $1,200 instead, then I will get the difference. And so there is a true-up mechanism. But again, you know, the system, you know, when we do tax administration is about, you know, doing our best to make sure that we administer fairly. And, you know, of course, when we make decisions, we look at where we can impact our people, one, the most quickly, and two, impact the most people. And when we make decisions, you know, again, that's how we go about in doing that.
Right. Daph, I had a question here. How about first-time filers that just filed this year?
First-time filers. So meaning that they just filed their 2019 return for the first time?
I guess. I don't know. They didn't put much in.
All right. So for somebody, again, if you filed either a 2018 or 2019 return already, there's nothing that you have to do. If you filed a 2018 tax return already, you don't have to do anything. If you filed your 2019 tax return already, you don't have to do anything in order to get on the list. That population of people is already on the list.
Okay.
However, you must file something, you must file in order to be able to get on the list. The IRS actually, and that is for people who actually have earned income. Now, the IRS in this past week did launch its online portal for what they're calling non-filers. And non-filers are basically those people who fall below the income thresholds, meaning that for a single person, I made less than $12,200. And because of that, I didn't have to file a return. Now, one most important thing is Guam residents, U.S. territory residents do not qualify to use the IRS online portal. So please don't go and register and file there. Mm-hmm. Everything that is going to be paid out for Guam residents is going to come out of Guam. So That's the first thing. The second thing is that we're actually developing a form, a non-filer form, and it's actually simulated or kind of patterned against what the IRS's form is. And that form will be released in this next week. And that form will be for those individuals, because I know the last time I had the opportunity to talk with you and Sabrina, that there was a question posed, if I receive only social assistance and I don't have earned income, how do I qualify, or what do I have to do? And so that non-filer form will be what is going to be utilized for individuals who are in that situation. They'll be able to utilize that and file it. It's going to be a manual form for now, but you know, I'm a big advocate for working to do online. So, you know, in the background, even though we're, you know, because we're trying to get these out as soon as possible, we're going to have a manual option, but we're going to be working to get hopefully the online versions up within I don't know, next several weeks.
Right, if you could, when you get that non-filer form, could you send that over to us so we can pop it up? Because I got a call from a lady who's on public assistance, disabled, and she actually called last week, and it just popped into my head when you talked about non-filers, and she was asking how she would, be able to qualify for any of this, the stimulus or the advance or any of that stuff. So she hasn't filed, so she would have to lodge that non-filer form with you guys.
Yes, she would have to. She would have to go ahead and fill out and sign a non-filer form and file it with us. And I will absolutely make sure, Chris and Sabrina, that you guys get that form as soon as we have it, and we'll release it again in this next week. We're just reviewing it. It's already basically prepared. It's in draft format. We just have to review it once more before we release it to the public.
And what about people who paid taxes? Do they still get any type of stimulus?
The economic impact payment is not based on your tax liability. The economic impact payment is based on your adjusted gross income, or what is reported on your. So people who might have had so whether you had to pay income tax, when you filed your return, or whether you got a refund, that is not related to your eligibility for the economic impact payment.
And then also, Daphne, just if you could confirm, because I heard you say this before. Deductions, if you owe government of Guam any type of money at the hospital or whatever, that's not going to be taken out of these stimulus checks, right?
Right, and so, and thank you for asking that question, because, the AG's office actually reached out to me to make sure that, with regards to any garnishments, that the child support piece was going to continue to be garnished. And we confirmed with them that, yes, our read of the law is that child support payments are the only garnishments. So, if you owe outstanding taxes, if you also owe for any other thing that we would normally garnish for, those are not going to be garnished for. The only garnishments for these economic impact payments are going to be for child support.
And I wanted to ask again, sorry, Bree's got a question, but
It's okay.
I've been working on this here. So the individual payments are $1,200 per tax filer, or $2,400 for joint or married filers, and then there's also $500 per child. Now, how does the $500 per child work? Is that just based on who claims the child or the children?
Well, first of all, it has to be, so the dependent has to be claimed on the taxpayer's return. So you must claim that individual or that child who has to be under age 17, so 16 and under. That 16 and under child dependent has to be claimed on your return in order for you to get the $500. And there is a phase out for that $500, an income phase out, but it's higher than the income phase out for the regular $1,200 or $2,400.
And then I wanted to again, you talked about the income phase out. I know it's up to a certain amount that you get the full $1,200. Can you break that down for us? And then what happens if you make over that amount, and how do they then calculate how much your stimulus will be?
Okay, and good question, because even for me, when I read the law, I thought this is very confusing. But when I looked at the mechanics of it, and I kind of used my little pencil and paper to try to figure it out, it made it much more simple. So how it works is, whether you're married filing joint, whether you're single or head of household, the income threshold, the economic impact payments start to get reduced. And how that works is, so for every $100 that you are over the threshold, you get reduced by $5. So, for example, if I made $75,100, then instead of getting $1,200 in an economic impact payment, I would get $1,200 minus $5, which would be $1,195.
So, I'm sorry to interrupt, but the cutoff is it $75,000 annually?
So $75,000 is right. That's where the level where you're going to get the full $1,200 if you're a single person. But again, for every $100 that you go up, you subtract out $5.
Okay.
So and that's the same. The same goes with if you're head of household or if you're married filing joint. For married filing joint, if you would get $2,400 if you were making $150,000 or less. If you make $150,100. Then you take out $5 again from the $2,400. Again, that is for every $100, it gets reduced by $5.
Okay.
And again, it's $500 per dependent.
Correct.
Right?
It's $500 for dependent child that is under age 17. So that's a 16-year-old and under. I mean, and on that note, you know, I mean, there have been articles. We try to stay kind of in touch with what's happening. You know, I believe that, you know, of course, after the CARES Act was passed, that, you know, that there were certain gaps that were still identified. Like, for example, like for me, I have if I have a child who's in college who I pay, is still reliant upon me 100% for their, you know, living expenses. The CARES Act does not. The $500 will not kick in for that individual, because the child dependent $500 is really for those child dependents who are under age 17.
Okay.
And
There was a question here. Will a child born in 2019 still qualify for a $500 stimulus check?
Right, and so again, that's where, you know, the true-up mechanism will kick in, right? For anybody who may not have received the full amount for whatever reason, you know, it could be because my income was higher in the year that we utilized versus, you know, again, the following year. There will be a mechanism for making sure that people are made whole. I don't have, again, the final guidance on what that will be. We'll issue that, you know, hopefully very soon, so that we can make sure people, you know, have that information. But definitely there's a mechanism for ensuring that people are made whole, and, you know, and that's important to us as well.
Mm-hmm. And I guess really the one question that everybody wants to know is, like, how soon? I know the governor, during the press briefing last week, when she announced that the advance payments would come out by the end of this week, she did kind of indicate that, you know, based on IRS approval, she was hoping within 2 weeks, so to get the remaining amount, which would be next week. So are we still looking at that, or?
Well, so I mean, I guess with regards to what was announced, my understanding is that what was announced is that within a couple of weeks of the implementation plan being approved, that's when we should be able to start seeing the mass payments be made. That still stands true. The idea, though, or at what point the implementation plan will be approved, that's something that, you know, is outside of our control. You know, I am definitely, again, like I said, in active communication with IRS at all times, and I'm grateful to our counterparts. I mean, like even at 1 o'clock in the afternoon Guam time, you know, they messaged me, which means that that's about 11 o'clock p.m. their time. And then the same stands true for me when it's like 11 o'clock midnight our time. I'm also communicating with them. So, you know, through the years, our team has developed this really great rapport, and I've had the opportunity to also develop my own relationships with our federal counterparts. And, you know, of course, it's been helpful that we've had this great rapport. And so, you know, we're constantly communicating. And like I mentioned, I can assure our community, and I promise you, you know, this EIP, these economic impact payments to our people, is very important to me. It's very personal to me. I've been actually asking people to pray for me, because I want to make sure that whatever decisions that I'm having to make, or recommendations I make to our governor, you know, they're good ones, because in the end, you know, I really care about taking care of our people. I recognize that our people are in need. I feel the needs of our people. I mean, it impacts me personally, because, you know, I was born and raised here. This is my home. And so I can assure you we're doing everything possible to get the implementation plan approved. And, you know, we've been working also internally to make sure that our IT infrastructure is set. And our team has been activated to make sure that, you know, that we're processing, and that we're, you know, going to make sure that once the implementation plan is approved, we receive the monies, that, you know, we can pull the trigger and we can move forward in making sure our people are paid as soon as possible.
Gun it! Pull the trigger. So that's what you're saying. So, sorry, I'm just trying to lighten it up a little bit.
You know, I tend to be very serious.
I know.
So, you know, this is just.
I think passionate.
Yeah, and people feel it, Daphne, and that's what we're really. And I think it's responsible of you to not put a timeline out there. I mean, Dave Della Sola does the same thing. It's really you know, contingent on the feds. But so let me ask you, when that implementation plan is approved with the IRS, from that point forward, what do we need to do, and what kind of timeline from that point forward, Daph? I'm not asking you to predict when it. Okay, good.
So, like, I mean, thank you. No, that's good, and thank you. You know, again, you're right. For me, if I start putting a number or a timeline out, and it doesn't happen, then, you know, I honestly don't know. It's totally out of our control.
Right.
But from the time the implementation plan is finalized, you know, and because basically for me, I believe for the most part, the majority of our, like 90% of our IT infrastructure is really set up already. We just have a few minor things here and there we need to work on. So once the implementation plan is finalized, then of course the monies get covered over to Guam. And then once those monies get covered over, and again, that could take, it could take a couple weeks. Then when the monies come over, then we'll be able to make those mass payments to our people. And that's, when we'll see. But if you see what's also happening stateside, you'll notice the IRS is actually processing payments in waves.
Right.
And that's likely going to be how we're also going to have to do it as well. And
you should do it alphabetically, Daph.
We should do it alphabetically?
Yeah.
Okay, well,
you know why, right?
Okay, I don't want to say anything because I'm either an M or an F.
Right, you're way.
Well, thank you so much, Daphne.
No, well, thank you more. Sabrina and Chris, I really have to say, one, I want to thank you guys for your patience. I know it's been difficult. I've been trying to get on, but it's been a challenge for me.
Mm-hmm.
So thank you for your patience. But I also want to thank the community for their patience. And I want to assure you that we're here at Rev Tax to try to help you the best we can. Our team is actually there working to make sure that we are able to answer questions. So if people have questions, don't hesitate to call us. We have great people there who, probably some of the most patient people I've ever met in my life, really, who are there to help our people and to answer the questions you have. We may not have all the questions that you answers at this time, but you know what? We will do our best to answer based on what we have. And once we have, the answers for the questions you have, we're going to provide those to you.
Thank you, Daphne. And since you asked me to pray for you, I always include you in my prayers, and I'll do so again today, okay?
All right. No, I appreciate it. You know what? I could use all those prayers, and I really, really appreciate it from the bottom of my heart.
Okay. God bless you, Daphne. Wash your hands, okay?
Bye.
Bye. There you go. Daphne Shimizu from the Department of Rev and Tax.
She's great, man. It's really good to hear from these directors, and even like people like Antone. Again, you hear it in their voice. You can feel like they really care, and they're working their hardest. They're a part of our community, and they know what they need to do.
So important to hear. I mean, people, you can tell when someone's being real with you, and we have nothing else to do during the shelter-in-place, social isolation, COVID-19 crisis. We have nothing else to do but sit here and listen to the people who are leading this response. Jason?
Okay, as far as the comments go, there were, obviously you guys saw, and there were a lot of different, I want to say, edge cases, scenarios, situations. A lot of people were being very forthright and just saying, okay, listen, I've got a 20-year-old and a 23-year-old. One's in school, one doesn't, one works part-time, but, makes less than $10,000. I mean, it runs the gamut, right?
Yeah.
If anybody out there, if you want to go back, feel free to throw in the information, pass out the numbers and everything like that. And if anybody else is watching from Rev and Tax, like from Gov Guam and everything like that, we'd love to have your input on this too, because I counted at least 60 or 70 different,
was a lot.
Yeah, and I mean, like I said, people were very, very honest about what their tax bracket is, what their financial situation, and what their family structure is.
Okay, so what I'm going to do, and I'm going to shoot Daphne a message, because obviously I don't know if we have the background or the pedigree or whatever to answer. I mean, I'm not even going to try. But I'm going to shoot Daph a message, and maybe she can, but I don't want to take anything away from them trying to get these checks paid out, but maybe someone from the department can kind of go through. I'll see what we can do. 9:40, we got to take a break. Wanted to throw this out here. Good morning to our KUAM TV 11 viewers. I do my little pageant wave there. And, of course, our Facebook Live viewers on KUAM News, streaming KUAM.com, the KUAM News app, and right here on the radio. It's Guam's favorite, 93.9 FM. For all of our Chamorro listeners out there and everyone else, too, let's do some Chamorro News now with Ken Conception from Isla 63.
Buenas tardes, tigi KUAM News Update givenut Chamorro para Bernes, dia 17 abril 2020. Ilanya si Major Anton Agon ginia DOC na para bago tao sa tabiha COVID-19 na chetnod guihi no kumuhum. Parewa dyan na di tribunal siya gita Amerika ni magkikisoda empenyo ni pero man at siguro na timasusedi adso. Asangan numbers paguha man susustui man magas guihi sa puruno na recruit na gwardiya ni Estaba guihi sa positibo i-test niya para COVID-19. Man mate sa pamalusan na recruit ni man dadan niya dyan na gwardiya zaman na fanhano para gumaan niya. Guihi tesi ni man na fanhano seti sa pero mabirya siya tatigid ya 18 giya Brit. Ano mafaisen ni KOAM ipamalo size ni tetena ni leg niya naman nang girusuto ni test niya ni matsogi ginigap niya. Siyagon sa sangani KUM na programa containing COVID-19 ginigam na ogan na sa tininaman gugwi ang puwengi. At sensati na sugi, datang ginmakto magahi da na tempo ni parogwahan ni natin ni COVID-19 gi ipreso. Lo sangan na lokwi na esta gwaha reglamento por parogtamano po maribahay riskaw nueste na tsetno disti ani masoda di uno na gwadda ni nazi. Ya reglamento sa maribaha pat manasua palo gi prebeleho ni prisionero siya. Ani mamasangani KUM po di tsanan sunia po disti na situasyon. Masangan lokwi po di taimano yan nemo ki staff kontra siya. Asangan siyagon na tiya tungo po dadso. Matsotsogi do po si hafa pero matsogi. Matsululi supplies ang kosa siya ay prisionero sa hunggang gwa na biyahe na wahades ganaw. Sa pwede makansela benesita tanay para idanan niya para ilirihon na aktibidad siya. Ilig niya na taigi shelter in place asti na sinistedi. Lo parewa dani matsotsogi. Jan taigi bidan niya itaw-taw gisan hizong ni manyar sa gahagi guma niya. Lo gwaha man disganaw zaman nalalalo sa pudesti. Asangan lo na sa prisionero matetes po di COVID-19. Zaman masangan ni prisionero no manatungo staff sa tanggin timamalik sa nintin niya pat man malongo. Ilig niya na gwaha tao to'y gwa memorial na medical staff gi DOC. Gwaha lo ko izon niya medical team. Sa tanggin gwaha ko dan malalang mo sa nintin niya. Man ma-referring sige das gwati gi medical staff sa marikonorsi. Pas maditid mina ko nisisita no ali dan mediku niya guhi. Masasangan siya gon na maribabay population ni preso sa masosota dito man empetun siya na prisionero. Lo gwaha gwi man masesapulan ni korti. Entiya di angko bracelet na artikulo. Ada na paluyi DOC sa estama prepara para isolation. Sa direktor di DOC si Joe Carbelido sa siyempre ti amma matutunan mo na ay mas si prisionero siya. Zaman tas mampus man disganaw prisionero man maditeta ni siya tan familya niya. Sa politisina man mambisita ilang niya siya ko na mafatsutsui pero matutunan talo muna siya ay familya. No fan NI supplies para prisionero man tas makonsisigi marsin na dahi puno fan inadin ni COVID-19. Esta madskukiti esti ilag niya ni pero man modifika schedule ni po ni na posible trasis tagi habon shampoo dan personal na kosas munagaskas ni por na halom gi preso tada trabia plano ni para taimano lumafatsutsui asangan masyanggo na sensitibo as tin situasyon no direktor sa malagon na por matsogis na si Vice Speaker Talina Nelson ipumalo siya na senador sa mabota munga sa malago gobyerno na pro ni Naimas Fedsa ay diyon niya ni pro fanagay tato ni Gumania no nandigay makupunta ST sa persempi mentalo ni Diretso niya no Ciudadano for infringement on civil liberties lumapasa sa isang diyo ni todo ay manalihigi sa kuro dito siya sa mga dito na maswat sa tigit sa nila provincial hour tapos sa Senate Mike 17 may busang oras na yung luka i-US ko ng publiko na Mike 7 di service mo yung paano para gusto ko ng magagawa Mr. Bentley ganun pa rin natin nila at sa mga pangkita pero kung maapasin ang jihad sa kaya pre-COVID-19 pandemic di mas news may mucho rin ang arts dahil sa pagkanya na para masuspendin sa milas temporary at hindi nasita ng Mr. Lord siya at malamang ng mga sumama rin sa mga sasawin sa mga sita at
love. We'll be there at McDonald's. I'm loving it.
We understand what matters to you because at Docomo Pacific, we're a family too. With the Now Family program, mom, dad, and kids stay connected on the latest devices the whole family can enjoy. For just $155 a month, get 3 lines with 30 gigs of 4G LTE data each, and endless use of your favorite apps without affecting your monthly data bucket. Add more, get more, save more. Docomo Pacific, better together. Some conditions apply.
Bridging the gap between you and your fitness goals is our main focus here at the Bridge Fitness. We are here and ready to keep you fit and healthy. If you're looking for a general physical preparedness program, personal training, strength and endurance programs, visit the Bridge Fitness on Instagram for our daily WOD updates. If you would like to take part in our program, email us at tbfguam1990@gmail.com for more information. Remember, Guam, stay safe and stay home. Bridge Fitness, bridging the gap between you and your fitness goals.
The Variety Taco 12-pack comes with crunchy tacos, nacho cheese, and Cool Ranch Doritos Locos Tacos. Available only at Taco Bell.
Guam's favorite. 94.
Can you guess what the most common disabling disease is for people ages 15 to 49? It's migraine. Are you surprised? Show people with migraine some support by participating in Shades for Migraine, a fun awareness campaign from the Association of Migraine Disorders. If you know someone with migraine, show them you care. Wear a pair of sunglasses on June 21st and post a photo with hashtag Shades for Migraine. Visit migrainedisorders.org to learn more. That's migrainedisorders.org.
Troopers 949 containing COVID. The KUAM News takeover of Guam's favorite on this Friday, the 17th day of April. Some of the main takeaways that we got on the show today, I think one of them from Dr. Hoa, one of the Governor's Physicians Advisory Group, one of the more independent-minded individuals on that group, has said that there's a shortage
of test kits, right? And medical equipment, the swabs.
Yeah. And so that's why we're wondering, the governor has been talking about ramping up testing. They balked at the idea of using these South Korea test kits. And, that coupled with, we only tested 12 people for COVID-19 yesterday. I kind of want to go back to something, I don't know who said it in session, but somebody had said, if we're going to do this curfew and all these things and make the people, do all these things, then the response on the government side should also be equal. So if we're asking the people to shelter in place, and then it needs to be justified by an appropriate response in fighting the coronavirus by the government. And I don't think testing 12 people a day just doesn't cut it. Mm-hmm. And if there is a shortage, then what they need to stop doing is just putting out these numbers and running and hiding or not being available, because if there's a shortage, then people need to know that. And I think that everyone knows it's a worldwide shortage, and we're all dealing with it. And so that's that. And thankfully, Dr. Hoa was able to share that with us, Bree.
Right. Definitely. Well, and what we're going to be hearing, at least that's what we've been told this afternoon during the governor's press briefing at 1 o'clock. Hopefully there's video. We were told that, I know some of you may have watched it yesterday. There was only audio.
Right.
We spoke with John Jr. Calvo. He said it was just a technical problem. Right. So it should be resolved today. Jason?
I just want to say,
hold on, Jay. Let me pop on your mic. Yeah.
I just want to say, by no means are we like vain people. But we pulled off like a really, really good hack to make that work yesterday, just so
Right.
we could get the video on there.
Yeah.
Right.
We had to do a lot of workarounds, but yeah, they've assured us that hopefully today is going to go back to normal and everybody's going to have full video, so you'll be able to watch the whole thing and comment on it and everything in its entirety.
Right, and we when we spoke with them, we assured them, look, we are a team, we're all in this together,
Mhm.
and if there's any sort of assistance that you need that we're here, and so that is always going to be on the table, and hopefully we can move past this and get this press conference today back with video.
What I want to share with the people of Guam, though, is that there is this movement with the governor's office to create their own state media, their own state news, which is what you see with them on the governor's Facebook page. And I think it's interesting because in talking with some of the advisors, the idea is that this is being done with President Trump, with governors around the nation. But I think what's problematic is that it's been done that way before COVID-19, and so the media is already dealing with so many barriers and limits to access and information that to kind of add another layer on top of that when we're just trying to get the info out to the people, I think is a little troubling.
Well, I mean, if they want to do a newscast or whatever, then do whatever you want to do.
Yeah.
But at the same time, I mean, maybe you shouldn't be focusing on that and focusing on getting the information to the people that are doing it every day.
Right.
And being transparent about it.
Yeah.
And not.
And
I know I can go on and on.
Yeah,
but I really rather
yeah.
not.
And a lot of it is kind of insider baseball, and that with us in the media here, we have our thoughts on what the media's role is, but
and it's not just us who are concerned about it. There's other media out there.
I think every other media has said things to us. Of course, we talk to our media colleagues, and they all feel the same way that the transparency is not there, and they might counter that by saying, "Oh, well, we have a press conference every day." Yeah, but you have a press conference every day that's under an hour, and I don't know why they don't take it more seriously, because the people of Guam we're in the dark, and so what's happening is everybody on the island and even many off the island are tuning in to watch these press conferences, which are supposed to be happening at 1 p.m., but then they just stroll in, la-di-da-di, 15, 20, 30 minutes later sometimes, and you see the comments. You see it in the comments, and that it just doesn't register to them that, hey, you got the whole island waiting on you, and then you just waltz in and do a little statement and give everyone their 2 questions and waltz right back out.
Right. And even when we decided we were going to do this radio show, I reached out to the communications team, let them know that we are going to be doing this radio show, and we are offering any time that you would like to come on.
Right.
And actually, we would like to hear from the governor, lieutenant governor, anybody from the Joint Information Center every single day, because we're doing this so that we can get the most up-to-date information out to the community.
But instead of that being done, what's happening is they're trying to do their own thing on their own Facebook, which, I mean, it's a free island. I get it. I get that you guys are going to ride, that the precedent is there, that it's been done. But I just think in a public health emergency, in a pandemic like this, a real communications team would be called, and I've seen it because we've all gone through many, many disasters, maybe not pandemics, but disasters. What a real communications team does is offer up people representing the administration, representing the response. So, back in typhoons, ran radio, how many years you get those calls? Hey, can, so-and-so go on? Can they call you up tomorrow? Because we really want to get people to get this info out, and they want to talk about this. Of course, sure. And that's kind of, I think, the difference. I mean, are they making these, government response leaders accessible? In some ways, yes, and we do appreciate that. But again, we're just here to get the information out to the people. We're not out to get anybody. We really don't have an agenda. If we are critical, it's coming from a place in that we have all these people who are wondering about things, who have questions about a variety of issues, whether it's COVID-19 and, the pandemic response, the testing and the medical side and all that stuff, or more things about the local assistance. And so we just wanted to get the floor for a minute and kind of explain some of the behind the scenes stuff that happens in all the media and islands, quest to get you guys the information that you really need and is so valuable at a time like this.
And again, at 1 o'clock, there will be a press briefing, hopefully on video. And it is anticipated that they're going to release this village by village breakdown of the confirmed cases of COVID-19 on Guam. It's something that the mayors have been asking for about a month now, and they finally got it during a video conference on yesterday. And we've confirmed this information with multiple sources. And so in the village of Agana, there is 0 confirmed cases of COVID-19. In Sinahanya, 4. Orat Chalanpago, 5. In the village of Jotnya, 5. Talafofo, 7. In Arahan, 2. Umatic, 0. In the village of Agate, 3. Santa Rita, 1. Petey, 1. Agana Heights, 5. MTM, 1. Barragata, 13. Mangilao, 14. In Jigo, 13. In the village of Dededo, 42. Tumuning, 15. Asan Maina, 0. In Malesu, 2. And so that adds up to 133. You add in the 2 that are homeless, that's 135.
Right, and then to kind of qualify this, the mayors have said that they're going to go back and they're going to get from Public Health the recovery information, any death information that could be applied to these different villages. And then what we're being told from the mayors, several of them, is that Public Health is going to move all this stuff over to their website.
Right, there's going to be a dashboard that's going to be created, and it's going to go online, and there will be a website for people in the community to look at it for themselves.
Right, and thankfully, man, I mean, the mayors, the doctors, the people in the villages have been asking for this, so it's good that it's finally happening. Sabrina, good job today.
Good job, Chris.
Yeah,
good job, Jace.
Good
Joe,
job,
sir.
Joe, sir.
People are saying this is actually, we've got a couple comments, especially, Chris, you're most passionate, speaking of passion, you're most passionate fan. Rosalind, she was going, this has been the best show yet that we've done this.
Wow.
Because we went through so many different things. Like you said,
Right.
we went through the breakdown of the villages, we went through the tax information, we talked to Doug Dominich for the federal perspective, and we got a lot of information today.
And a lot of good work, everybody.
Right.
Yeah. Okay.
So make sure you join us 1 o'clock.
Okay,
Yes, Jace?
real quick question for the two of you. What are you guys going to do because we're all staying home this weekend. What are you guys going to do to pass the time or make sure that, your kids, don't get bored and that they stay home and we stay safe and we stay home and save lives?
Well, we do what's called rottening our brains. That's what I call rottening our brains, which is we watch movies. There's a little bit of device time, and then we kind of also do letters, drawing, anything with a pen and pencil.
Nice.
That could get them to sit down and do that. But we really try and do is my kids are taking this way serious. Like, they don't even want to go outside. I got to practically pull them outside. Let's go get some sun. Even to go to the beach. They're like, no, Dad, coronavirus. So the fear is real, and I kind of like it because I know they're taking it serious. And my boy, my 6-year-old boy, actually was getting his hands. I mean, we're all getting this with the Hilitai hands.
Oh man!
Right, his hands were just jacked up because he was just taking when we're like, wash your hands. It was really hitting home for him. So he was washing his hands way too much, and I had to be like, Chase, dude, your hand. Whoa. So sorry, that was a TMI. I'm just letting you guys know. So another way we pass the time, Jay, is by gathering around the table and having a meal together as a family. That's something that, and you talk about these little COVID silver linings. That's something that we don't always get to do because of the hustle and bustle out here working, coming home late, no time to put dinner together, grabbing something at a restaurant or so. I really value, and I try and make it so that one meal a day when I got the kids, we all sit around and I make a big spread and we all just sit there and eat the food and, commune as a family. And it's really important to do that. And it's something that we don't always get to do, right?
Very nice. Can I take a guess at what you'll be doing?
What?
But this is good. This could go wrong 500 different ways. Right? I'm gonna guess because I know you. We shared the news set together for 16 years. Kung Fu movies. You're gonna watch The Mandalorian again for the 9th time. And you're going to play basketball with your son in your little driveway court.
Right. And then I really got to do homework. We have to work on that.
Man.
Homework.
Yeah, Bree's a teacher.
Hey, well, I'm going to host
She teaches for, St. Anthony?
well,
we
just
have
to make
a lot of homework.
To make sure that everybody on Guam, if you guys want to join me, I love movies.
Wait,
and
I
everything.
just wanted to say,
sorry.
like, to his teachers, really try to get him to do his homework. But, as long as I work, my days are extremely long. So when I get home, I am really tired. And, I have to sanitize myself and then try and do homework from a good distance. And that's why he's been kind of lagging behind on
Well,
his
Bree,
homework.
I don't think your boy or you are alone in this. You know what I mean?
Yeah. No, but I feel bad. Like, oh, man, I haven't turned it in. And
I'm hosting a watch party for
Oh,
Netflix
yeah.
movies.
Yeah,
I'm
Jay's
doing
been
that
doing
again.
this.
Chrome extension.
So what are you going to watch party, Jay?
I think we're going to do Major League 2.
Wow.
Because we can't partake of the Major League Baseball season right now, so we might as well watch cheesy movies about Major League Baseball.
Okay, so there you go. If you're on Jason's Google Chrome thingamajig, if you got that figured out, congratulations, nerd. Hey, Sabrina, good job.
Good job, everybody. Thank you, guys.
Thank you guys so much for listening. Really, each and every one of you guys out here listening, watching, you're the reason why we continue to get up in the morning. Real talk. 10:02, I want to leave with one of Sabrina's favorite songs. Good job, Bree.
Thanks. You too.
Okay, it's a Netnang Gef Pok Gu with Sen Guaida Hao Guahan. Guahusi Chris. Esta. Adios.
Bye.